Good evening from the Health Education campus of Case Western Reserve University and the Cleveland Clinic. I'm Chris Wallace of Fox News, and I welcome you to the first of the 2020 presidential debates between President Donald J. Trump and former Vice President Joe Biden. This debate is sponsored by the Commission on Presidential Debates. The commission has designed the format, 6 roughly 15-minute segments, with 2-minute answers from each candidate to the first question, then open discussion for the rest of each segment. Both campaigns have agreed to these rules. For the record, I decided the topics and the questions in each topic. I can assure you, none of the questions has been shared with the commission or the two candidates. This debate is being conducted under health and safety protocols designed by the Cleveland Clinic, which is serving as the health security advisor to the commission for all 4 debates. As a precaution, both campaigns have agreed the candidates will not shake hands at the beginning of tonight's debate. The audience here in the hall has promised to remain silent. No cheers, no boos or other interruptions, so we, and more importantly you, can focus on what the candidates have to say. No noise except right now, as we welcome the Republican nominee, President Trump, and the Democratic nominee, Vice President Biden.
How you doing, man? How are you? I'm well.
Gentlemen, a lot of people have been waiting for this night, so let's get going. Our first subject is the Supreme Court. President Trump, you nominated Amy Coney Barrett over the weekend to succeed the late Ruth Bader Ginsburg on the court. You say the Constitution is clear about your obligation and the Senate's to consider a nominee to the court. Vice President Biden, you say that this is an effort by the president and Republicans to jam through an appointment and what you call an abuse of power. My first question to both of you tonight: why are you right in the argument you make and your opponent wrong? And where do you think a Justice Barrett would take the court? President Trump, in this first segment, you go first, 2 minutes.
Thank you very much, Chris. I will tell you very simply, we won the election. Elections have consequences. We have the Senate, we have the White House, and we have a phenomenal nominee, respected by all, top academic, good in every way, In fact, some of her biggest endorsers are very liberal people from Notre Dame and other places. So I think she's going to be fantastic. We have plenty of time, even if we did it after the election itself. I have a lot of time after the election, as you know. So I think that she will be outstanding. She's going to be as good as anybody that has served on that court. We really feel that. We have a professor at Notre Dame, highly respected by all, said she's the single greatest student he's ever had. He's been a professor for a long time at a great school. And we won the election, and therefore we have the right to choose her. And very few people knowingly would say otherwise. And by the way, the Democrats, they wouldn't even think about not doing it. If they had, the only difference is they'd try and do it faster. There's no way they would give it up. They had Merrick Garland, but the problem is they didn't have the election, so they were stopped. And probably that would happen in reverse also. Definitely would happen in reverse. So we won the election, and we have the right to do it, Chris.
President Trump, thank you. Same question to you, Vice President Biden. You have 2 minutes.
Well, first of all, thank you for doing this, and looking forward to this, Mr. President.
Thank you, Joe.
The American people have a right to have a say in who the Supreme Court nominee is. And that say occurs when they vote for United States senators and when they vote for the President of the United States. They're not going to get that chance now because we're in the middle of an election already. The election has already started. Tens of thousands of people have already voted. And so the thing that should happen is we should wait. We should wait and see what the outcome of this election is, because that's the only way the American people get to express their view is by who they elect as president and who they elect as vice president. Now, what's at stake here is the president's made it clear he wants to get rid of the Affordable Care Act. He's been running on that. He ran on that, and he's been governing on that. He's in the Supreme Court right now trying to get rid of the Affordable Care Act, which will strip 20 million people from having insurance, health insurance now, if it goes into court. And the justice, and I have nothing, I'm not opposed to the justice. She seems like a very fine person. But she's written before she went on the bench, which is her right, that she thinks that the Affordable Care Act is not constitutional. The other thing that's on the court, and if it's struck down, what happens? Women's rights are fundamentally changed. Once again, a woman could be pay more money because she has a pre-existing condition of pregnancy. They were able to charge a woman more for the same exact procedure a man gets. And that ended when we, in fact, passed the Affordable Care Act. And there's 100 million people who have pre-existing conditions, and they'll be taken away as well. Those pre-existing conditions, the insurance companies are going to love this. And so it's just not appropriate to do this before this election. If he wins the election and the Senate is Democrat or Republican, then he goes forward. If not, we should wait until February.
All right.
There aren't 100 million people with pre-existing conditions. There aren't 100 million people with pre-existing conditions.
According to a new analysis by the Department of Health and Human Services, 50 to 129 million, 19 to 50% of non-elderly Americans have some type of pre-existing health condition. Up to 1 in 5 non-elderly Americans with a pre-existing condition, 25 million individuals, is uninsured under the Affordable Care Act starting in 2014. These Americans cannot be denied coverage, be charged significantly higher premiums, be subjected to an extended waiting period, or have their benefits curtailed by insurance companies.
There aren't 100 million people with pre-existing conditions. 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 As far as the say is concerned, the people already had their say. Okay, Justice Ginsburg said very powerfully, very strongly, at some point, 10 years ago or so, she said a president and the Senate is elected for a period of time, but a president's elected for 4 years. We're not elected for 3 years. I'm not elected for 3 years. So we have the Senate, we have a president.
It's elected to the next
during
election.
that period of time, we have an opening. I'm not elected for 3 years. I'm elected for 4 years. And the 100 million people, Joe, the 100 million people is totally wrong. I don't know where you got that number. The bigger problem that you have is that you're going to extinguish 180 million people with their private health care that they're very happy with.
That's simply not true.
Katie Keith, JD, MPH, serves as part-time research faculty for the Center on Health Insurance Reforms. She also is a principal at Keep Policy Solutions, LLC, where she advises nonprofits and foundations on healthcare issues and conducts original legal, policy, and qualitative analysis to support policy goals. Her work includes an emphasis on implementation of the Affordable Care Act and its impact on underserved populations, such as the LGBT community. Katie is a co-founder and steering committee member of Out to Enroll, a national initiative to connect LGBT people with coverage options under the Affordable Care Act. She is also an appointed consumer representative to the National Association of Insurance Commissioners and an adjunct professor at the Georgetown University Law Center, where she teaches courses on the Affordable Care Act and LGBT health law and policy. She also provides, following the ACA, rapid response analysis for the Health Affairs blog. Katie received her law degree from Georgetown University Law Center and holds a master's in public health from Johns Hopkins University.
Electionomics.
And I'm Alexis Christoforous. Few issues have more sharply divided Republicans and Democrats over the last decade than healthcare. It is a hot topic once again as we near the election, and this week we're going to delve into the healthcare policies of President Trump and Democratic nominee Joe Biden. And to help us do that is Katie Keith. She's a health law professor at Georgetown University and a contributing editor at Health Affairs. Katie, great to have you here on Electionomics. There's plenty to get to, but I want to start with the incumbent because when President Trump was candidate Trump, he campaigned on repealing and replacing President Obama's Affordable Care Act. And even with a Republican-controlled Congress, he couldn't do that. So is dismantling the ACA still the centerpiece of the Trump administration's healthcare policy?
It's a great question, and I think the answer depends partially on what day you ask and who you ask. But in general, we have really seen a movement away from repealing and replacing the Affordable Care Act as sort of a plank. There was an analysis done by the New York Times recently of how few times Obamacare was even mentioned during the Republican National Convention. It was one of these centerpieces back in 2016 that not only President Trump, but every Republican presidential candidate had run on repealing and replacing the ACA. It's a whole different world now. And I think if you look at that shouldn't be that surprising if you look at the midterm elections. So all during 2017, Republicans in charge of Congress and the president did try multiple times and failed to repeal the law, in part because it's at a record high popularity, believe it or not, about 10 years later. And so in 2018, I think healthcare was a huge issue in the midterms. It helped Democrats retake the House. And especially when you look at COVID-19, the idea of talking about repealing and replacing something that's extended, health insurance to about 20 million Americans is, perhaps unsurprisingly not that popular of an idea. So there really has been a downplaying of the Affordable Care Act. Yeah, it's just not as much of an issue. You don't hear them talking about it as much.
So, Katie, can you talk about that lawsuit that's still out there? I mean, it seems like there's been a lawsuit trying to kill the ACA since the day it went into effect, which actually I think is probably literally true. But there's this one remaining lawsuit that was, I believe, brought by the state of Texas, and the Trump administration is a party to this lawsuit on the side of the plaintiffs who are still trying to kill the ACA. So could you just explain where that stands and what the timing is on that?
Yeah, that's absolutely right. And you're exactly correct. Within minutes of the Affordable Care Act being signed into law back in 2010, it was challenged in court, and those same fights are still playing out today. And so, this lawsuit stems from the big tax reform bill that the Republican-led Congress adopted in 2017 at the end of the year, where they zeroed out the individual mandate penalty of the ACA. And what they're arguing then in court, led by the Attorney General of Texas, and you're exactly right, Rick, joined by the Trump administration, is that the mandate is now unconstitutional, and because it's unconstitutional, it's so essential to the entire rest of the ACA that the whole law should be struck down in court. And so we've been watching this lawsuit. It was filed in February of 2018. It's been winding its way through the courts ever since. One court has already said the entire law should be thrown out, the entire Affordable Care Act, and now it's pending before the Supreme Court. And so it's very sort of high stakes. All but 4 states have weighed in on the case one way or another. You have the Trump administration, the House of Representatives, and California is leading sort of a coalition of Democratic attorneys general to defend the ACA because the Trump administration has declined to. So we'll see oral argument in that case on November 10th, so exactly 1 week after this year's election, and we'll get a decision on that in 2021. And so you're exactly right. While Republicans aren't necessarily talking about repealing and replacing the ACA, they're very much supporting a lawsuit that would sort of do the same thing, accomplish the same goals through the court system. It's almost a judicial repeal of the law.
So we really wouldn't know the fate of the ACA until after the election. But if ACA is not going to be the focal point of a Trump administration healthcare policy, then can you outline for us what is at the centerpiece here?
Yeah, so it's a little, you have to sort of separate what the Trump administration has pledged to do and what their goals are versus what they've actually done. So I think if you focus on what their priorities are, they've done an incredible amount around price transparency. So many different types of rules. This is the idea that everyone should be able to walk into a hospital and know exactly what a service costs. I think that one's actually pretty popular politically and is something that, who knows, but maybe a Biden administration would continue. So price transparency. The president has had a big focus on prescription drugs, trying to bring down the cost of prescription drugs. They have tried a lot of different things. He signed, I think, 4 executive orders recently focused on prescription drug issues. But the experts that I know on that issue say that none of those have really had an impact. Drug prices continue to stay high. Folks continue to have problems paying their bills. And so there's a big emphasis on some of these issues, but very little to show for it, where a lot of the policies that they were pushing in the first term, at least, have not yet come to fruition. Other things have been kind of alternatives to the ACA, things we call short-term plans, association health plans. And then there's been a big focus on rolling back women's health protections, so things like abortion access, access to contraceptives, sort of having a religious freedom element of healthcare. So I think those are some of the big, the last one I'll mention is sort of tying immigration and healthcare together. I don't think it's any surprise that this administration has had a big focus on immigration across the board. And so there have been a number of executive orders and things like that to really sort of limit immigration for those who can't pay their healthcare costs, to discourage immigrants from getting the healthcare that they need.
Hey guys, I'm going to read the entire healthcare platform of the Trump campaign for a second term. And for anybody who feels like, oh no, I couldn't possibly sit through a 45-minute recitation of some healthcare policy. No, I can get through this in less than a minute. This is the entire Trump campaign healthcare plan. Cut prescription drug prices, put patients and doctors back in charge of our healthcare system, lower healthcare insurance premiums, end surprise billing. I'm almost done. Cover all pre-existing conditions, protect Social Security and Medicare, and last but not least, protect our veterans and provide world-class healthcare and services. That's it. That's the whole thing. There are no, there's no like, here's how we're going to cut prescription drug prices. Here's how we're going to cover pre-existing conditions, just as they're going to do this. So, Katie, I'm not going to ask you to explain their plan or what they mean by any of these things. But when President Trump says his plan for a second term is cut prescription drug prices, that raises the obvious question: why didn't you do that during your first term?
I got to jump in there because on that point, Ivanka Trump, his daughter and advisor at the RNC, talked about drug pricing and actually said that her father has told her in private that the big pharma companies are really upset with him, and they wouldn't be upset with him if he wasn't doing something right and trying to lower those prices. So would you agree with that? I mean, has he done anything to lower the prices?
Yeah, what do we know about prescription drug prices during the last 4 years?
Yeah, so I think the thing that they tout the most is that they've had more approvals of generic drugs through the FDA than prior administrations. But the data just doesn't show that prices have gone down. They rolled out a lot of initiatives on access to insulin, things like that. But the truth is, a lot of their most ambitious proposals have not been finalized or have been tied up in court. And so maybe they're arguing that their sort of soapbox, shaking their fist at high drug prices is somehow having an influence, but that's not what the data shows, and they don't have any signature achievements to actually point to say, hey, this is what we've done, and here's what you could expect in the second term. So the evidence just isn't there. A lot of those initiatives have stalled out. They haven't finalized them. They've been challenged successfully in court.
So there's a big difference between trying to make changes with executive orders, which is what President Trump has tried to do a lot, and getting legislation passed, which is normally the best and most effective way to make these changes. But I don't think there has been any healthcare legislation that has passed under the Trump administration, including when Republicans controlled Congress for 2 years. Did they pass anything on healthcare?
You could argue that a lot of the COVID relief packages did include certain health protections, right? Things like, I'm trying to be generous here, I guess, make sure I'm not missing anything.
Didn't he recently redirect his administration to make it cheaper to import cheaper drugs, I guess, from Canada? Is that something? I mean, it's not necessarily legislation, but I guess it was an executive order.
That's an executive order. They've talked about drug reimportation quite a bit. I believe, though, that there was a proposal they first put in place that they haven't finalized yet. And so then this new executive order was kind of recharging that up. Or, a cynic would say they're trying to play politics and get credit for something that hasn't been implemented yet. They've been working with states like Florida to try to get drug reimportation going. Nothing has happened yet, though, right? And so there are these ideas out there. That's one that even actually has some popularity on the left, too, right? Bernie Sanders is in favor of drug reimportation. But there's really not anything to show for it besides a lot of maybe press releases, executive orders, things like that.
So I have a question about drug reimportation. Correct me if I'm wrong here, Katie, but I think the idea is because other countries basically set price controls on prescription drugs and we don't for the most part, that's why they're cheaper overseas. And the idea is that we could import them from overseas at those lower prices. But there's one caveat here, which is if those countries agree to it. And I've heard some commentary from Canada of people saying, so if the United States just starts importing Canadian Canadian drugs because we have price controls in Canada and you don't. Well, our prices we're just going to have scarcities or we're going to have problems like that. So doesn't the re-importing country have to agree?
I think that's part of it. And Canada has said exactly that of, well, I don't know what it would do to their prices, but they're worried about shortages, right? Even of just making those drugs available. So it could be one of those situations too, where if you could build drug reimportation, but you might not actually have the supply to support it when it comes down to it. There's also, I've heard concerns raised about safety. Who's going to check the quality of drugs coming in? Counterfeit drugs are a big issue, those types of things. So it sounds somewhat simple, right? Oversimplified to just, well, they pay less, why don't we just reimport it from there? There's the devil's in the details, as it is with most things as we talk about healthcare.
So we're having trouble coming up with any actual real Republican healthcare plan here. But let's give them another chance. So to go back to this Trump campaign,
The bulleted list.
the bullet points. I just want to hit on this other one. Cover all pre-existing conditions. Now, pre-existing conditions that has already been taken away because of the ACA, correct? So can you explain where we stand on pre-existing conditions and what would change if that lawsuit were to succeed?
Yeah, great question. So as of now, I think this is one of the, if you know nothing else about the ACA, you know it protects people with pre-existing conditions, right? This has been sort of drilled into folks' minds over the past 10 years that the law's been in place. This is one of those, and the way that this works, there's no sort of one single way to protect people with pre-existing conditions. You have to look at all factors of health insurance to make sure that, I don't have to pay more, my benefits will be covered, I can't be denied coverage by my insurance company. It's sort of a multifaceted issue. It's very easy to say we're going to protect people with pre-existing conditions, but the truth is all during 2017, when we watched Republicans in Congress try to repeal the law, this was a sticking point. Every one of their alternative proposals would either leave folks with pre-existing conditions unprotected, paying more, facing benefit gaps, or it would result in significant coverage losses where you have millions, if not tens of millions of people losing coverage. And so when I'm just somewhat skeptical when I hear the president say, or some Republicans in Congress say, we're going to absolutely protect people with pre-existing conditions. There's no evidence that we've seen that shows that they have a proposal that would do that. It's something very easy to say, much harder, easier said than done. Let's put it that way. And so that's something I'm very much watching out for. I do think it's going to take a lot of sort of fact checking by news organizations and things like that to make sure that folks really do understand who would be protected or not. And to your point, this lawsuit that is working its way through the system that the Trump administration very much supports, the goal would definitely be to get rid of those protections for people with pre-existing conditions.
So I guess the idea is, if the court, well, it's really just the Supreme Court at this point because Congress is going to do it. If the Supreme Court were to kill the ACA, the idea is, I think it would not happen like the next day, right? There would be some kind of implementation period because people would still have insurance they had purchased through the ACA, through the exchanges, and the Congress would have time to pass a new law that said, okay, all the ACA is dead, but we're going to just pass this one standalone thing that says insurance companies have to take people with pre-existing conditions and can't charge them more. You're saying that's just really oversimplified and not the way it works in the real world?
I think it's wishful thinking is probably the way I would put it. If the court, I would expect this decision, it'll be kind of a blockbuster Supreme Court decision. It will come down in June of 2021, as most of those blockbusters come down. You're exactly right. Folks would be in the middle of their coverage year. I don't know that we'll get sort of an off ramp, right? That we'll have a bunch of months for Congress to get its stuff together and actually, protect people and correct whatever fault the court finds. So it's going to be something really, really important to watch. What I will say is that, everything we're fighting about is about zeroing out of the individual mandate penalty. And so there are folks who call it save, sever, or sink. So Congress could actually fix this issue very easily. They could save the mandate by taking it from $0 to maybe a $5 mandate. That would make it magically constitutional again, and then everything would be fine. They could sever it. They could go in and add a severability clause to the ACA and make it much easier, or they could sink it and just strike that provision and all the cross references. And so I think when we're talking about this case, there's this idea of, Congress would have to reenact the entire Affordable Care Act, which would be extremely challenging. It almost didn't happen the first time around in 2010. But really, we're just talking about this one provision. And so I think there would be some fighting over that in Congress and, lots of negotiations that would take place. The truth is, if you had a president to sign it, which, I think that's a question right now, even if Congress could get it together in a bipartisan way to sort of fix whatever problem the court finds with it, would you have a president to sign that bill? And that a lot of that, if we're just sort of leaving that with President Trump, I don't know what the answer to that would be. It's just another reason that I think the next administration is going to have a huge impact on the future of the Affordable Care Act.
Katie, I follow
We've been
your.
talking about- We've been talking about healthcare and haven't talked about COVID-19 yet. And Trump's job approval rating since the pandemic, we know, hit a new low. So where do Republicans go next on COVID-19, Katie? Because we saw the Democrats, light into the response from the White House saying that there was no federally mandated response, like everybody has to wear a mask. Biden has pointed to that. So where do Republicans go from here? And could this really be the thing that trips up a Trump reelection?
I mean, at this point, and you could sort of see it from watching the Democratic National Convention too. I think keeping the focus on the virus and the lack of a federal response here, whether it's on with access to PPE and having states fight against each other, whether it's a lack of a national testing strategy, whether it's sort of maybe mismanagement perhaps of the PPP program, you name it. There've been all kinds of issues with the federal response here. I don't know where Congress goes next. And so there was hope. I'm based here in DC. There was hope that you would have this next COVID package. The Senate, the House has passed multiple bills on this issue. They sort of gone nowhere in the Senate, and so you sort of have an effort being led by Majority Leader Mitch McConnell. And the negotiations are ongoing, and they've totally fallen apart, right? So folks left town without really getting anything going. Right now, the packages don't seem to be that focused on healthcare at all, which in this kind of crisis, I think is so frustrating to watch people losing their jobs, which means losing their health insurance. The testing, testing from delays to access seems woefully, outdated. We just need a lot more help there. Looking at the public health system, there's just so many issues, and instead, I think the debate has been around liability for businesses, definitely schools, the Postal Service, and the last package I looked at before they left town, it had some public health funding primarily for testing and contact tracing, but it doesn't feel like on healthcare, in my opinion, Congress is really rising to meet the moment that we find ourselves in a global pandemic on the healthcare side. There's been an incredible amount of assistance that's gone out. I wish we were focused a little bit more on healthcare.
This is a good segue to what Joe Biden might do, but I do want to just go one more question on the ACA because I guess I'm obsessed with this, but this is such a big deal. I followed your analysis on this, Katie, at your blog on health affairs, and it seems to have gone from legal experts thinking this Texas lawsuit had very little chance in the courts, and then the courts seemed to validate it in surprising ways, I guess, at the appellate level. And now there seems to be a more serious concern that the Supreme Court could actually kill the ACA. I mean, that could happen, right?
It could definitely happen. I don't know how likely it is with this court, the 9 justices that are on the court now, the 5 justices who voted to uphold the ACA the first time around in NFIP, the big 2012 Supreme Court decision, they're all still on the bench.
And John Roberts, the Chief Justice, was the same in the case, right?
And he wrote that decision, that's right. What I don't know is if you have a different court, for example, if those 9 justices, if that makeup changes, I think the ACA could be in a lot more trouble. I also think even I'm going to use air quotes, a narrow ruling of just the mandate goes and then the protections for people with pre-existing conditions go, that would also create an incredible amount of chaos. So even if my point there is, even if the court didn't strike the entire law, striking down bits and pieces here and there could open up all kinds of problems for patients, for the healthcare system, for all that. So I think it's a very real risk and not something to be underestimated at all. And the fact that the Trump administration has kind of put its thumb on the scale in favor of Texas and other states arguing against the ACA in its entirety, it's very unusual for them to take a position like that, and I think shows kind of the ideology behind opposing the Affordable Care Act. I don't have any other explanation except for ideology for them to take that position.
So that's the one side of the equation, the Republican plans or lack of plans. So what do you think could be the priorities and might actually change if Joe Biden wins? And I think it's important to say, for Biden to really get anything done on healthcare, he would probably have to have Democrats take control of the Senate. So do you have a feel for what the top one or two healthcare priorities would be if that were the scenario?
I think at this point, I might have said something different, 6 months ago, as many of us might have said, but I think there will be a very strong COVID response. And I'm not quite sure what the Biden administration is thinking on that point. I think that is shifting all the time. But you could look to the bills that have been passed by Democrats in the House to get an example of that. Much bigger spending bills, better protections for the uninsured, all kinds of major changes there. I mean, what's in his campaign plan is definitely building on the ACA, so making the subsidies for folks in the individual market much more generous, allowing more folks to enroll, creating sort of a workaround for the 12 states that haven't expanded their Medicaid program, so that would expand coverage to another 4 million people who fall in that gap right now. Many of these things, I think, are things that the Democrats in the House have already worked on or have pending bills. So in some ways, I think folks could be pretty quick. It will absolutely, though, depend on the makeup of the Senate and whether the filibuster is going to stick around, right? If you only need 51 votes to make some major changes as opposed to 60, I think you'd see a lot more sort of core Democratic priorities get passed through. If you still need 60 votes, I think we might still be in a light gridlock, to be perfectly honest with you, especially around healthcare. I had been someone who was hopeful that after the repeal efforts over the ACA failed in 2017, that maybe we would have a moment of just moving on the ACA politics of, the Democrats can't approve it, but the Republicans can't repeal it. Maybe we can just get over it. And then you have this lawsuit that we've been talking about get filed, and it has just really maintained the law's saliency as a political issue. And so now you will have kind of ACA politics hanging over everything that a new Congress might want to do, even if they would want to move on and do things like surprise medical bill protections and, again, more COVID response, actual prescription drug changes, that kind of thing. So there's a lot of Biden priorities. I don't know if it'd be helpful to drill down. And I don't know how they would put them on the bullet point list or what order they would put them in, but I'd be happy to dig in further. And I should say, I think there's things the Biden administration can do on its own, aside from Congress, sort of an executive level strategy. So there's probably two things going on there.
Yeah, I think we need another podcast. I think we need another podcast to dig into all of that. Before we wrap up, though, I don't think mental health gets enough attention in anybody's healthcare policy. And I want to talk about that in relation to the pandemic, because a recent poll showed 53% of adults in this country reported that their mental health has been negatively impacted because of worry and stress about the virus. Do either one of these candidates have a real mental health policy plan?
This is not my area of expertise. I do know the Biden administration has put forward, I know they talk about mental health. I know this is a big priority for them. I could not tell you exactly what their policies are. I'm sure the Trump administration would say the same, but I also can't think of much that they've done in this arena. I think it's a focus. The other thing that I would add that I haven't mentioned is I think given the COVID-19 response, given the disparities that we all knew about, but that are getting unearthed in healthcare, like who's having communities of color be dramatically more affected by COVID-19, I do think that the Biden administration is also looking at this from a disparities angle too, and that you'd see a lot more attention on things like maternal health, especially for Black women, addressing some of the death rates, differences in mortality rates, things like that. So I think there's even going to be a doubling down of emphasis on who is most impacted and who is most at risk.
All right, Katie Keith, health law professor at Georgetown, contributing editor at Health Affairs. Thanks for being with us. Be sure to rate and review what you just heard and saw, and you can follow me at Alexis TV News.
Me at Rick J. Newman, and you all know my Twitter feed is just a stream of love.
Thanks, everybody. We'll see you next time.
Well, you're certainly going to socialist. You're going to socialist medicine.
Fact check. It's not true that Biden's healthcare plan would kick 180 million people off their insurance. Biden has proposed a public option which would allow people to voluntarily join a government-run healthcare program similar to Medicare. But if they want to keep their current insurance, under Biden's plan, they would be able to. Trump and other Republican lawmakers have repeatedly claimed that Biden and other establishment Democrats gave to progressive lawmakers like Rep. Alexandria Ocasio-Cortez of New York. Last week, one White House representative described Biden as a prisoner of the radical, extreme, socialist left. In fact, Biden often comes under attack from his progressive rivals for his centrist record and long history of collaborating with Republicans. Though he adopted some positions endorsed by progressives, he has not embraced the benchmark policy proposal they've advocated, Medicare for all. Biden opposes government-run universal health care and has instead pushed to expand the Affordable Care Act, the law also known as Obamacare. The former vice president also pushed back on the socialist label, saying during the debate that he defeated the socialist, referring to Senator Bernie Sanders, the Vermont independent who challenged Biden in the Democratic primary and describes himself as a Democratic socialist.
Gentlemen, we're now into open discussion.
Open discussion.
Open discussion. Yes, I agree. Go ahead, Vice President.
Number
Biden.
one, he knows that what I proposed. What I proposed is that we expand Obamacare and we increase it. We do not wipe any. And one of the big debates we had with 23 of my colleagues trying to win the nomination that I won, were saying that Biden wanted to allow people to have private insurance still. They can. They do. They will under my proposal.
It's not what you've said,
But
and it's not what your party has said.
That is simply
your party
a lie.
doesn't say it. Your party wants to go socialist medicine.
My party is
and
me.
socialist
right
healthcare.
Now, I am
and
the
they're going to
Democratic
dominate
Party.
you, Joe. You know that.
I am the Democratic Party right now. The platform of the
Not according
Democratic
to
Party
Harris.
is what I, in fact, approved of. What I approved of. Now, here's the deal. The deal is that it's going to wipe out pre-existing conditions. And by the way, the 200,000 people that have died on his watch, how many of those have survived? Well, there's 7 million people that contracted COVID. What does it mean for them going forward if you strike down the Affordable Care Act. and
Joe, you've had
pre-existing conditions.
308,000 military people dying because you couldn't provide them proper health care in the military. So don't tell me
I'm
about
happy
this.
to talk about
And
this.
if you were here,
Look,
it
here's
wouldn't
the
be
deal.
200, it would be 2 million people because you were very late on the draw. You
Late
didn't
on
want
the
me to
draw.
ban China, which was heavily infected. You didn't want me to ban
All right, gentlemen,
Europe, which was heavily
Mr. President,
You would have
Mr.
been much
President,
later, Joe.
Mr. President,
much later.
Mr. President,
You're talking about 2 million people.
You're not gonna be able to
President, as
shut
the
him up.
moderator, we are going to talk about COVID in the next segment, but go ahead.
Let me finish. The point is that the president also is opposed to Roe v. Wade. That's on the ballot as well in the court. And so that's also at stake right now. And so the election is already
You don't know it's on the
begun.
ballot. Why is it on the ballot?
Because
Why is
you
it on the
said
ballot? It's not
you're-
on the ballot.
It's on the ballot in the
I
court.
don't think so.
In the court. Well,
There's nothing happening there.
Donald, would you
And you
just be
don't
quiet
know
for a
her view on Roe v. Wade. You
I
don't
don't
know her
know.
view.
Well, all right, let's talk. We got a lot to unpack here, gentlemen. We got a lot of time. So, on health care, and then we'll come back to Roe v. Wade.
All right.
Mr. President, the Supreme Court will hear a case a week after the election in which the Trump administration, along with 18 state attorneys general, are seeking to overturn
That's right.
Obamacare, to end Obamacare. You have spent the last...
Because they want to give good health care.
If I may ask
ahead.
my question, sir.
good health care.
Over the last 4 years, you have promised to repeal and replace Obamacare, but you have never in these 4 years come up with a plan, a comprehensive plan
Yes,
to
I have.
replace Obamacare.
Of course I have.
Well, I'll
I
give
got
you an
rid of
opp-
the
I'm gonna- and when I
individual
finish,
mandate.
I'm going to give you an
Excuse
opportunity.
me. I got rid of the individual mandate, which was a
That is
big
not a
chunk of
comprehensive
Obamacare.
plan.
That is absolutely a big thing. That was the worst
I
part of
didn't ask,
Obamacare.
sir.
Chris,
You're
that was the
debating him,
worst
not
part of
me.
Obamacare.
Let me ask my
Well,
question.
I'll ask Joe.
The
The individual
mandate
mandate was the most unpopular aspect of Obamacare. I got rid of it.
I'd like
and
you
we
to,
will protect
Mr.
people
President,
with
I'm the
pre-existing
moderator of this
conditions.
debate, and I would like you to let me ask my question, and then you can answer your
ahead.
question. You, in the course of these 4 years, have never come up with a comprehensive plan to replace Obamacare, and just this last Thursday, you signed a largely symbolic executive order to protect people with pre-existing conditions 5 days before this debate. So my question, sir, is what is the Trump health care plan?
Well, first of all, I guess I'm debating you, not him, but that's okay. I'm not surprised. Let me just tell you something, that there's nothing symbolic. I'm cutting drug prices. I'm going with favored nations, which no president has the courage to do because you're going against Big Pharma. Drug prices will be coming down 80 or 90%. You could have done it during your 47-year period in government, but you didn't do it. Nobody's done it. So we're cutting health care.
What about
All of the
pre-existing
things that
conditions?
we've done,
He has not cut
insulin.
health
I give
care.
you an example. Insulin. It was destroying families, destroying people. The cost. I'm getting it for so cheap. It's like water. You want to know the truth? So cheap. Take a look at all of the drugs what we're doing. Prescription drug prices. We're going to allow our governors now to go to other countries to buy drugs because
When in
they
fact-
pay just a tiny fraction.
As I say,
of
this
what
is
we do.
open discussion.
No,
Let
but
me
this
ask
is
you about,
big.
you'll
This
be
is
happy,
big stuff.
sir. You'll be happy. I'm about to pick up on one of your points to ask the vice president, which is he points out that you would like to add a public option to Obamacare. And
Yes.
the argument that he makes and other Republicans make is that that is going to end private insurance.
It is
and
not.
well, if I
sorry.
can ask you the question, it will
Not what
end
your party says, by the way.
it will end private insurance and create a government takeover of health care.
It does not. It's only for those people who are so poor they qualify for Medicaid. They can get that free in most states, except governors who want to deny people who are poor Medicaid. Anyone who qualifies for Medicare would, Medicaid would automatically be enrolled in the public option. The vast majority of the American people would still not be in that option, number one.
Joe, you
Number
agreed
two.
with Bernie
Number-
Sanders, who's
I
far
did-
left, on the manifesto,
when
we
you-
call it.
when
And that
manifest-
gives you socialized medicine.
Look, hey,
Are you saying
I'm not
you
going to
didn't
listen
agree?
to him. The fact of the matter is, I beat Bernie Sanders.
Not by much.
I beat him a whole hell of a lot. I'm
Not by
here
much.
standing facing you, old buddy.
Pocahontas would have left
Well,
2 days
I tell
early.
you,
You would have lost every primary.
All he knows how to
on
do
Super
is hurt.
Tuesday. You got
Look,
very lucky.
here's the deal. I got very lucky. I'm going to get very lucky tonight as well. And tonight I'm going to
With
make
what?
sure because
With what?
here's the deal. Here's the deal. The fact is that everything he's saying so far is simply a lie. I'm not here to call out his lies. Everybody knows he's a liar.
But you
I just
agreed.
want to
Hey,
make sure.
Joe, you're the liar.
I want to make sure.
Graduated last in your class, not first in your class.
God, I want to make
Mr.
sure.
President, can you let him finish, sir?
No, he doesn't know how to do that. He has,
You'd be surprised.
You pick
You'd be surprised.
the
Go ahead,
wrong
Joe.
guy,
Go,
the
go,
wrong
Joe,
night at
go.
the wrong time.
Listen, you agreed with
Here's the
Bernie
deal.
Sanders to the
The
manifesto.
whole idea.
Let
Now you're
him-
disavowing it.
There
Go ahead.
is no manifesto, number
Please
one.
let him speak, Mr.
Number
President.
two.
You just lost the left.
Number two.
You just lost the left. You agreed with Bernie Sanders on a plan
Folks,
that's absolutely
folks,
agreed
do you have
to,
any
and under that
idea
plan,
what
you have
this clown's
socialized,
doing?
They call it
Mr.
You
Mr.
have any
President.
do?
socialized medicine.
Mr.
Well, I
President,
tell you what, he is not for any help for people needing health care because
Bernie?
because he in fact already has cost 10 million people their health care that they had from their employers because of his recession. Number one. Number two,
yeah.
there are 20 million people getting health care through Obamacare now that he wants to take it away. He won't ever look you in the eye and say that's what he wants to do. Take it away.
No, I want to give them
Number
better
three.
health care at a much lower price
But-
because
and by the way,
Obamacare
he doesn't
is
know
no
how.
good.
He doesn't know how
I've
to do
already
that.
fixed it.
He has never
I've
offered
already
a
fixed
plan.
it to an extent.
He has never
Obamacare,
done a
as you
single
might
thing.
know, but probably don't.
But,
Obamacare
gentlemen, you realize
is no
if you're
good,
both
Joe.
speaking at the
It's no
same
good,
time,
and it's too expensive.
let the president go ahead, sir.
Obamacare is no good. We made it better. And I had a choice to make very early on. We took away the individual mandate. We guarantee pre-existing conditions, but took away the individual
true.
mandate. Listen, this is the way it is. And that destroyed, that they shouldn't even call it Obamacare. Then I had a choice to make. Do I let my people run it really well or badly? If I run it badly, they'll probably blame him, but they'll blame me. But more importantly, I want to help people, okay? I said, you got to run it so well.
That's what he's
and I
known
just
for.
had a meeting with them. They said, the problem is no matter how well you run Obamacare, it's a disaster. It's too expensive.
I got you.
Premiums
I
are
got
too
it.
high, and
That's
it
what his
doesn't work.
people- that's
so
what his people
we
said.
do want to
No,
get
no,
rid of it.
it's
Chris,
an
we
open
want to get rid of it.
I
and
understand
give
it, sir, but
something
I have
that's
to
cheaper and
give you
better.
roughly equal time.
Good.
Please let the vice president talk.
Good.
He has no plan for health care. Of
course we do.
Please.
He sends out wishful thinking. He has executive orders that have no power. He hasn't lowered drug costs for anybody. He's been promising a health care plan since he got elected. He has none, like almost everything else he talks about. He does not have a plan. He doesn't have a plan. And the fact is, this man doesn't know what he's talking about.
All right.
He's
I have
against it.
one final question for you,
Sure.
Mr. Vice President. If Senate Republicans, we were talking originally about the Supreme Court here, if Senate Republicans go ahead and confirm Justice Barrett, there has been talk about ending the filibuster or even packing the court, adding to the 9 justices there. You call this a distraction by the president, but in fact, it wasn't brought up by the president. It was brought up by some of your Democratic colleagues in the Congress. So my question to you is, you have refused in the past to talk about it. Are you willing to tell the American people tonight whether or not you will support either ending the filibuster or packing the court?
Whatever position I take in that, that'll become the issue. The issue is the American people should speak. You should go out and vote. You're in voting now. Vote and let your senators know how
you gonna
strongly
pack
you
the
feel.
court?
Vote now.
gonna pack the
Make
court?
sure you, in fact, let people know
He doesn't wanna
you're
answer the
senators.
question.
I'm not going to answer the question
Why
because
wouldn't you answer that
because
question?
the
You wanna
question
put a lot of
is the
new
question
Supreme Court
is
justices,
the
radical
question-
left.
Will you
Who
shut
is
up,
on,
man?
Listen, who is on your list, Joe?
This
Who's
is
on your
so
list?
right.
Gentlemen,
This is-
I think
This
we've
is
ended
so
this.
He's gonna pack the
unpresidential.
court.
That
We
is
have
fun.
I'm not gonna give a list.
We have ended this segment. We're going to move on to the second segment.
That was really a productive segment, wasn't it? Keep yapping, man.
The people understand, Joe.
They sure do.
47 years you've done nothing. They understand.
All right. The second subject is COVID-19, which is an awfully serious subject. So let's try to be serious about it. We have had more than 7 million cases of coronavirus in the United States, and more than 200,000 people have died. Even after we produce a vaccine, experts say that it could be months or even years before we come back to anything approaching normal. My question for both of you is, based on what you have said and done so far and what you have said you would do starting in 2021, why should the American people trust you more than your opponent to deal with this public health crisis going forward? in this case, the question goes to you first, sir. 2 minutes uninterrupted.
Good luck. 200,000 dead. As you said, over 7 million infected in the United States. We, in fact, have 4% of the world's population, 20% of the deaths. 40,000 people a day are contracting COVID. In addition to that, about between 750 and 1,000 people a day are dying. When he was presented with that number, he said, it is what it is. Well, it is what it is because you are who you are. That's why it is. The president has no plan. He hasn't laid out anything. He knew all the way back in February how serious this crisis was. He knew it was a deadly disease. What did he do? He's on tape as acknowledging he knew it. He said he didn't tell us or give people a warning of it because he didn't want to panic the American people. You don't panic. He panicked. In addition to that, what did he do? He went in and we were insisting that the Chinese, the people we had on the ground in China should be able to go to Wuhan and determine for themselves how dangerous this was. He did not even ask Xi to do that. He told us what a great job Xi was doing. He said we owe him a debt of gratitude for being so transparent with us. And what did he do then? He then did nothing. He waited and waited and waited. He still doesn't have a plan.
Wrong.
I laid out
Sir,
back
it's
in
2
March
minutes.
exactly
it's so
what we
wrong.
should be doing. And I laid out again in July what we should be doing. We should be providing all the protective gear possible. We should be providing the money the House has passed in order to be able to go out and get people the help they need to keep their businesses open schools. It costs a lot of money. You should get out of your bunker and get out of the sand trap and get in your golf course and go in the Oval Office and bring together the Democrats and Republicans and fund what needs to be done now to save lives.
So if we would have listened to
You have 2 minutes, sir.
if we would have listened to you, the country would have been left wide open. Millions of people would have died, not 200,000, and one person is too much. It's China's fault. It should have never happened. They stopped it from going in, but it was China's fault. And by the way, when you talk about numbers, you don't know how many people died in China. You don't know how many people died in Russia. You don't know how many people died in India. They don't exactly give you a straight count, just so you understand. But if you look at what we've done, I closed it, and you said he's xenophobic. He's a racist, and he's xenophobic because you didn't think I should have
unrelated to
closed
your
our country.
COVID. No,
Wait a
sir,
minute.
It's his 2 minutes.
You didn't think we should have closed our country because you thought it was terrible. You wouldn't have closed it for another 2 months. By my doing it early, in fact, Dr. Fauci said President Trump saved thousands of lives.
Dr. Fauci, let me ask you a question. You've been doing this a long time. Have you ever seen this big of a coordinated response by an administration to such a threat, a health threat?
Well, we've never had a threat like this, and the coordinated response has been, there are a number of adjectives to describe it. Impressive, I think, is one of them. I mean, we're talking about all hands on deck. Is that I, as one of many people on a team, I'm not the only person, since the beginning that we even recognized what this was, I have been devoting almost full time on this, almost full time. I'm down at the White House virtually every day with the task force. I'm connected by phone throughout the day and into the night. When I say night, I'm talking 12, 1, 2 in the morning. I'm not the only one. There's a whole group of us that are doing that. It's every single day. So I can't imagine that under any circumstances that anybody could be doing more. I mean, obviously, we're fighting a formidable enemy, this virus. This virus is a serious issue here.
Many of your Democrat governors said President Trump did a phenomenal job. We worked with the governor. Oh, really? Go take a look.
What governors say about Trump's response to coronavirus? Even some governors who have been critics of the president are openly grateful for federal supplies. But the administration's response to the outbreak has still received mixed reviews. Vice President Mike Pence, fresh from a conference call with nearly all of the nation's governors, spoke this week about how much those governors appreciated President Trump's leadership in the midst of the coronavirus outbreak. The president's leadership has made the difference here, Mr. Pence said at a White House news conference on Monday. I heard it again today from 47 governors. The governors, who find themselves grappling with an escalating national health crisis, have begun raising their own voices in a mix of frustration, gratitude, alarm, and pleas for assistance. The usual partisan stances have been scrambled. Mr. Trump has won praise, particularly from Republican governors, but other members of his party have criticized him for confusing messages and a sluggish response from the Centers for Disease Control and Prevention. At the same time, some Democrats who are usually critics of the president have praised the federal government and urged a spirit of cooperation, even those Mr. Trump has verbally pummeled. But across the board, governors from both parties say that they are hesitant to be too publicly cutting at a time when their states desperately need federal resources. And as the coronavirus crisis deepens by the day, they have made a realization they're on the front lines. What I've been saying to other governors is, you're on our own. Governor Andrew M. Cuomo of New York said on Wednesday, one split reality in federal-state relations, political rancor at the top but working relationships in lower ranks, has been most evident in Washington state, where more than 200 cases of the coronavirus have been reported. Mr. Trump said last week that he had a lot of problems with Governor Jay Inslee, a Democrat, calling him a snake. Yet Mr. Inslee's office reported a productive relationship with the federal government. Last week, Mr. Inslee, who has been an outspoken critic of Mr. Trump on issues like immigration and school safety, hosted Mr. Pence, the head of the federal coronavirus task force. The two men greeted each other with a friendly and virus-conscious elbow bump. Some 33 federal workers were dispatched to Washington state, state officials said, and a request for supplies from the Strategic National Stockpile, additional N95 respirators, masks, gowns and gloves has been fulfilled. Another batch of supplies is on the way. The vice president has made himself available to governors on a regular basis, has done regular check-ins, and has moved the ball forward on some key asks that we've made of the federal government, including expanding who can be tested. Casey Cottums, an advisor to Mr. Inslee, said on Tuesday, some governors, even those who appear frustrated with Mr. Trump over a dearth of coronavirus testing kits, have been hesitant to attract his wrath on Twitter. Others have been less reserved. In an interview on Tuesday, Gov. J.B. Pritzker of Illinois, a Democrat, said the federal government had not lived up to its expectations when it came to making coronavirus tests available. Mr. Cuomo of New York, a Democrat and a frequent critic of the president, has described the administration's response as bad government and poor planning. Mr. Trump, for his part, has accused Mr. Cuomo and his brother, the CNN anchor Chris Cuomo, of politicizing the outbreak in an effort to harm him. One Republican governor, Larry Hogan of Maryland, mixed criticism and praise. Mr. Trump, he said on Sunday on NBC's Meet the Press, hasn't communicated the way I would and the way I might like him to. Mr. Hogan hastened to add that the rest of the team has been doing a pretty good job. Mark Sanford, a Republican and a former governor of South Carolina, said he was not surprised that governors and administration officials had found a way to work together amid the coronavirus crisis. There is professionalism among the federal government's disaster response ranks, he said, in the reality that governors must often be practical problem solvers rather than strict ideologues. I'd suspect most governors would sort of take as a simple reality that Trump likes to be obnoxious and to attempt to push people around, said Mr. Sanford, a noted critic of the president who briefly sought the Republican nomination for president. Different governors will come up with different strategies in dealing with that. Some more confrontational than others, but at the end of the day their motivation is going to be that they're able to meet a challenge and be credited for meeting that challenge. Alex Honnett, a Republican strategist who worked in the George W. Bush administration, said that governors and the president's team stood to benefit from appearing to be collaborating in such circumstances. In times like these, voters don't want to see their political leaders sniping at each other, he said. They want to see competent, nonpartisan cooperation. One notable flash of peace came on Sunday from Gov. Gavin Newsom of California, a Democrat and one of Mr. Trump's most vocal critics. At a news conference, Mr. Newsom described the process of managing a cruise ship on which at least 21 people tested positive for the virus. He also praised Mr. Trump, saying the president had said everything we could have hoped for during a phone call. We're very grateful for this partnership, Mr. Newsom said. The administration's challenge in delivering coronavirus testing kits to the states has been one of the most pressing concerns among governors. On Friday in Atlanta, Mr. Trump said anyone who wants a test can get a test. His Health and Human Services Secretary, Alex Azar, too, later clarified that only people who have consulted with a doctor or medical professional could get a test. In New York, Andrew Cuomo said he had been frustrated by a testing process hampered by federal bureaucracy. About 1,000 people in the state have been tested, and Mr. Cuomo estimated that hundreds of thousands more were awaiting testing. The process has been slowed because New York is waiting for private laboratories to be allowed to test for the virus, a step that requires federal approval, he said. While Mr. Cuomo said he was hoping to ramp up testing in the coming days, it depends how fast they can authorize these private labs. For states with a small number of cases, testing does not appear to be troubled, he said. But in New York, where more than 170 people already have tested positive for the virus, that is not the case. What number of tests do you need? Mr. Cuomo said, I have a population of 18 million. What do I need? 2 million? He declined to characterize the federal government's response to the coronavirus outbreak on the whole. I try not to comment, he said, because the president then tweets nasty things about me.
I would like to emphasize that this was all said well prior to the dramatic uptake in cases and deaths. March 11, 2020. Here is a more recent take on Democratic governors' opinions of the Trump administration's coronavirus response. Cuomo, Whitmer call for investigation into Trump's coronavirus response. The governors of New York and Michigan have traded criticisms with Trump over his handling of the pandemic, accusing him of putting his re-election ahead of public health. By Alexa Lardy-Erie, staff writer, September 24, 2020, at 2:14 p.m. New York Gov. Andrew Cuomo and Michigan Gov. Gretchen Whitmer are calling for congressional investigations into the Trump administration's politicization of the pandemic response. The Democratic governors singled out President Donald Trump, saying in a joint statement on Thursday that the unprecedented and unacceptable scale of this tragedy is the direct result of President Trump and the federal government's deceit, political self-dealing and incompetence. It is an inarguable fact that the United States has had the worst response to the COVID-19 virus of any nation in the world, the statement read. According to Johns Hopkins University, the U.S. has the highest number of reported coronavirus cases globally, with more than 6.94 million. The U.S. also has the highest reported death toll, at more than 202,240. Both Cuomo and Whitmer have traded sharp jabs with Trump over the handling of the pandemic, with the governors accusing the president of putting his re-election ahead of public health. The governors charged that the president put the health and safety of Americans in the hands of politicians whose first priority was securing re-election of their benefactor rather than turn to public health experts for advice and guidance, leading to predictably tragic results. The statement went on to comment on news that the White House blocked a plan to send free masks to American households in April, calling the move heartbreaking. Additionally, the governor slammed some of the health guidelines published by the federal government,
including those related to airborne transmission of COVID-19 and others, saying that people without symptoms should not get tested. It's increasingly clear that the president and his advisors are trying to undermine the credibility of experts whose facts run counter to the administration's political agenda, the governor said. Congress must immediately conduct an oversight investigation into the Trump administration's response to this pandemic. Ellipsis. The question of, what did they know and when did they know it, cannot be left to the history books to answer, the statement continued. Our future health and economic security depends on holding the Trump administration accountable today. Alexa Lardy-Erie. Staff writer Alexa Lardy-Erie is a reporter and digital producer for the Civics section of U.S. News & World.
The governors said I did a phenomenal job. Most of them said that. In fact, people that would not be necessarily on my side said that. President Trump did a phenomenal job. We did. We got the gowns. We got the masks. We made the ventilators. You wouldn't have made ventilators. And now we're weeks away from a vaccine.
Will there be a coronavirus vaccine before the November 3rd presidential election? Incumbent U.S. President Donald Trump certainly hopes so. But even if his long-shot prediction were to come true, the realities of producing, distributing, and administering one or more COVID-19 vaccines mean it could still take months before most people in the U.S. received one, and possibly even longer before life returns to some semblance of normal. That hasn't stopped the Trump administration from ratcheting up expectations. And vaccine manufacturers aren't the only ones responding to pressure from the White House to hurry along the approval of a vaccine, either. The New Yorker reports that some Chinese officials are taking Trump's timeline seriously enough to rush approval of their own vaccines. That revelation comes on the heels of another investigation by the New York Times that details how China has been administering significant numbers of experimental coronavirus vaccines outside the typical testing process. Many worry that a similar disregard for safety protocols could lead to the premature approval of a vaccine in the U.S. Currently, there are 7 vaccine candidates being tested in the U.S., 3 of which are nearing the final stages needed for Food and Drug Administration approval. Considering SARS-CoV-2, the virus that causes COVID-19, was only discovered less than a year ago, the progress is actually happening at a faster clip than ever before in the history of infectious disease. Vaccines take, on average, about 10.7 years to develop, despite Trump's claim that vaccine development is being intentionally stifled. Here, we survey the current landscape for a developing coronavirus vaccine. This article updates frequently and is intended to be a general overview and not a source of medical advice. If you're seeking more information about coronavirus testing, here's how to find a testing site near you. Important COVID-19 vaccine news. Worldwide COVID-19 deaths have topped 1 million, with 33.4 million active cases in what the World Health Organization says is likely an underestimate. Everyone in the U.S. should have access to a vaccine by April 2021, top U.S. infectious disease official Dr. Anthony Fauci told Congress. Fauci said people in the U.S. might begin receiving COVID-19 vaccinations as soon as November and December, during an interview with Dr. Howard Bauchner, editor of the Journal of the American Medical Association. Over $6 billion in U.S. government contracts with vaccine makers is effectively untraceable, as it was routed through a private party defense contract management firm. According to NPR, 2 U.S. vaccine trials are currently on hold, one from Oxford University AstraZeneca and another from Inovio. COVID vaccine development is getting faster. Several acceleration efforts are currently underway, like the White House's Operation Warp Speed, which is meant to cut through regulatory red tape to speed up vaccine development and be ready to distribute vaccines as soon as they receive FDA approval. So far, the U.S. government has pledged over $10 billion to several vaccine manufacturers to secure a total of 800 million vaccine doses. Vaccines typically take about 10 to 15 years to develop and approve, through 4 phases that include human trials. But with Operation Warp Speed, rather than submitting all sections of the application after all 4 phases are done, approved vaccine projects can submit data to the FDA bit by bit. Meanwhile, the program is also financially backing efforts to start manufacturing doses while clinical trials are still ongoing. That means if and when those vaccines do get approved, there will already be a store of doses ready to distribute nationally. I would hope that by the time we get well into the second half of 2021 that the companies will have delivered the hundreds of millions of doses they have promised, Dr. Anthony Fauci, the director of the National Institute of Allergy and Infectious Diseases, told Forbes in August. Promising coronavirus vaccines from UK, US, China. Here's a quick look at some of the frontrunners in the race to find a vaccine for COVID-19, including where the vaccines are being developed, where they are on testing them, and when scientists think they might be ready for widespread distribution, if known. Oxford University AstraZeneca, UK. AstraZeneca has paused testing of its vaccine, which it had begun on 100,000 human volunteers in at least 3 countries and was preparing to begin in the US. Lead researcher Dr. Sarah Gilbert had initially said they're aiming for a fall 2020 release, which may now be delayed. However, UK Health Minister Matt Hancock has said such a pause is not necessarily a setback. Moderna, US, and apparent scuffle with government regulators delayed large-scale human testing, but Moderna's CEO has told Barron's he still expects the company will know by Thanksgiving if the vaccine is safe and effective and should be able to distribute it in early 2021 if it is. Pfizer, US, although its 4 COVID-19 vaccine candidates are still in early-stage human trials, 2 of them have been fast-tracked by the FDA. Pfizer's chief business officer told the U.S. Congress the company may be ready to apply for FDA approval by October. Sinovac, China, currently testing its vaccine on about 10,000 human volunteers in China and about 9,000 in Brazil and is set to begin testing on about 1,900 test subjects in Indonesia soon. CEO of Biopharma, Sinovic's Indonesian partner, has said he expects the vaccine to be ready by early 2021. Sinopharm, China, currently testing about 15,000 volunteers in the Middle East in a trial the state-owned company expects to last 3 to 6 months. Early results suggest the drug is safe and at least somewhat effective. Sinopharm recently built a second facility to manufacture the vaccine, doubling its capacity to about 200 million doses per year. CanSino Biologics, China, set to begin large-scale human trials this summer. CanSino's vaccine has already been approved for the Chinese military. The vaccine is based on a modified common cold virus, which some experts warn could make it less effective than other vaccine efforts. Will there be just one vaccine for everyone? We probably won't know until next year, but Fauci has suggested it might require several different vaccines made and distributed by different labs to bring an end to the pandemic, in a paper published May 11 in the journal Science. He also has said he foresees different vaccines being given to different patient populations. For example, one vaccine for elderly or other high-risk patients, another for healthy adults, another for children, etc. What happens if we never find a coronavirus vaccine? Coronaviruses are a large class of viruses and so far there are no vaccines for any of them. While there are promising early results, there's no guarantee of a vaccine by 2021. Statistically, only about 6% of vaccine candidates ever make it through to market, according to a Reuters special report. Early evidence suggests that the coronavirus doesn't appear to mutate as quickly or often as the flu, and it's thought that the virus has not yet mutated significantly enough to disrupt vaccine development, although our knowledge could change. The longer we go without a vaccine, the more likely focus will shift toward treatments, such as the experimental antiviral drug remdesivir, which has reportedly shown promising results, and dexamethasone, a steroid that doctors say increases survival rates among the most serious cases. With effective therapeutic treatments, many viruses that used to be fatal are no longer death sentences.
A strategic approach to COVID-19 vaccine R&D, a public-private partnership and platform for harmonized clinical trials, aims to accelerate licensure and distribution by Lawrence Corey 1, 2, John R. Moscola 3, Anthony S. Fauci 4, Francis S. Collins 5. There is an unprecedented need to manufacture and distribute enough safe and effective vaccine to immunize an extraordinarily large number of individuals in order to protect the entire global community from the continued threat of morbidity and mortality from severe acute respiratory syndrome coronavirus 2, SARS-CoV-2. The global need for vaccine and the wide geographic diversity of the pandemic require more than one effective vaccine approach. Collaboration will be essential among biotechnology and pharmaceutical companies, many of which are bringing forward a variety of vaccine approaches. 1. The full development pathway for an effective vaccine for SARS-CoV-2 will require that industry, government, and academia collaborate in unprecedented ways, each adding their individual strengths. We discuss one such collaborative program that has recently emerged, the ACTIV Accelerating COVID-19 Therapeutic Interventions and Vaccines Public-Private Partnership, spearheaded by the U.S. National Institutes of Health, NIH. This effort brings together the strengths of all sectors at this time of global urgency. We further discuss a collaborative platform for conducting harmonized, randomized controlled vaccine efficacy trials. This mechanism aims to generate essential safety and efficacy data for several candidate vaccines in parallel, so as to accelerate the licensure and distribution of multiple vaccine platforms and vaccines to protect against COVID-19 coronavirus disease 2019. We currently know little about what constitutes a protective immune response against COVID-19. Data from SARS-CoV-1 patients as well as recently infected SARS-CoV-2 patients document relatively high levels of immune responses after infection, especially antibody responses to the surface spike protein that mediates entry into host cells. However, in vivo data on the type or level of immunity required to protect from subsequent reinfection and the likely duration of that protection are currently unknown. In animal models of SARS-CoV-1, immunization with recombinant subunit proteins and viral and nucleic acid vectored vaccines as well as passive transfer of neutralizing antibodies to the spike protein have been shown to be protective against experimental infection. 2-3. Endpoints vary from protection of infection to modification of viral replication and disease. These data bring optimism that a highly immunogenic vaccine will elicit the magnitude and quality of antibody responses required for protection. The role that T-cell immunity plays in preventing acquisition or amelioration of early disease, either in animal challenge models or in human coronavirus disease, is unclear. 4. This constitutes another reason why a diversity of vaccine approaches must be pursued. A high degree of safety is a primary goal for any widely used vaccine, and there is theoretical risk that vaccination could make subsequent SARS-CoV-2 infection more severe. This has been reported for feline coronaviruses and has been observed in some vaccine challenge animal models of SARS-CoV-1. 5. These preclinical data suggest that the syndrome of vaccine-associated enhanced respiratory disease results from a combination of poorly protective antibodies that produce immune complex deposition, together with AT helper cell 2 (Th2) biased immune response. The potential mechanism behind vaccine-induced immune enhancement and the means to minimize this risk have recently been reviewed. 6. It will be important to construct conformationally correct antigens to elicit functionally effective antibodies, a lesson learned from vaccine-induced enhanced lower respiratory illness among infants receiving a formalin-inactivated respiratory syncytial virus (RSV) vaccine. Animal models of SARS-CoV-2 infection are currently being developed, and these models can be used to better understand the immune responses associated with protection. 7. Clinical and immunological endpoints. The primary endpoint for defining the effectiveness of a COVID vaccine also requires discussion. The two most commonly mentioned are I, protection from infection as defined by seroconversion, and E, prevention of clinically symptomatic disease, especially amelioration of disease severity, including the frequency of disease requiring high-intensity medical care with some assessment of a decrease in hospitalization. This requires a close evaluation of the effect of vaccination on the severity of COVID-19 disease in a wide variety of epidemiological and medical settings among both younger and elderly populations, as well as underserved minorities. All of these issues need to be evaluated in the context of these initial efficacy trials. Achieving these endpoints could also be associated with reduced transmissibility on a population basis. Primary endpoints that involve reduction of disease require greater numbers of enrollees into trials given that asymptomatic infection is estimated to be 20 to 40% of total cases of COVID-19. 8. Initial efficacy trials may then require large initial enrollment with ongoing monitoring of both serologic and clinical endpoints. A major challenge leading to a degree of complexity in developing clinical trial protocols for serological endpoints is the lack of precise knowledge of incidence rates. 9. A critical requirement for such a multi-trial strategy is the establishment of independent laboratories with similar or identical validated serologic assays to provide a harmonizing bridge between multiple vaccine products and multiple vaccine efficacy trials. The use of these laboratories for each clinical trial or the sharing of critical specimens from a trial should be required. Parameters that would distinguish the immune response resulting from vaccination versus from infection are under intense investigation, and there is an immediate need to develop assays to address this issue. Efficacy trials need to be evaluated for both benefit and harm. The likelihood of SARS-CoV-2 re-exposure is much higher than that of SARS-CoV-1, which has disappeared from community circulation, and hence longer-term evaluation of potential enhancement with re-exposure is needed. This requirement does not preclude licensure based on the endpoints outlined above, however. It does indicate that more prolonged follow-up of the initial vaccine cohorts should be undertaken. The durability of clinical and serologic endpoints will also need to be explored, as waning of immunity is common with human coronavirus infections. 10. Coronaviruses have a single-stranded RNA genome with a relatively high mutation rate. Although there has been some genetic drift during the evolution of the SARS-CoV-2 epidemic, major alterations in the spike protein are not extensive to date, especially in the regions thought to be important for neutralization. This enables cautious optimism that vaccines designed now will be effective against circulating strains 6 to 12 months in the future. 11. The possibility of performing controlled human challenge trials, in which a small number of volunteers are vaccinated and subsequently challenged with SARS-CoV-2, has been suggested. Such experiments, if designed to define potential immune correlates or winnow out less effective vaccine approaches, may have utility. However, this approach has shortcomings with respect to pathophysiology and safety. 12. Although the risk of severe disease or death in young healthy individuals from COVID-19 is quite low, it is not zero, and we do not yet have proven effective therapies for COVID-19 to rescue volunteers with complications from such a challenge. It is likely that SARS-CoV-2 challenge strain will, by design, cause mild illness in most volunteers and thus may not recapitulate the pulmonary pathophysiology seen in some patients. Moreover, partial efficacy in young healthy adults does not predict similar effectiveness among older adults with major cofactors associated with COVID-19 disease, nor would it prove reduction of transmissibility to major susceptibility groups. Whether such experiments may be worthy of pursuit or would have a beneficial impact on timelines for vaccine development needs careful evaluation by an independent panel of ethicists, clinical trialists, and experts on vaccine development. Vaccine platforms. It is encouraging that vaccine development efforts have moved swiftly, and several major vaccine platforms are moving toward clinical evaluation. These include traditional recombinant protein, replicating and non-replicating viral vectors, and nucleic acid DNA and mRNA approaches. Each of these vaccine platforms has advantages and limitations. Important characteristics include speed and flexibility of manufacture, safety and reactogenicity, the profile of humoral and cellular immunogenicity, durability of immunity, scale and cost of manufacturing, vaccine stability, and cold chain requirements. No single vaccine or vaccine platform alone is likely to meet the global need. And so a strategic approach to the multi-pronged endeavor is absolutely critical. Several companies are developing nucleic acid-based vaccines, including Moderna, BioNTech, Pfizer, CureVac, mRNA-based, and Inovio, DNA-based. DNA and mRNA-based vaccines can be generated quickly on the basis of viral sequence, which allows a rapid pathway to the clinic. 1314. Currently, optimal immunogenicity of DNA requires an electroporation or an injector delivery device to facilitate DNA entry into cells. mRNA vaccines use lipid nanoparticles to protect and deliver the mRNA and effectively adjuvant the immunogen. The scalability of these lipid nanoparticles and their temperature stability are issues that need to be addressed. Although there is a wide body of early-phase clinical experience with nucleic acid vaccines, none are licensed for widespread usage. As such, the path forward is filled with optimism. But some uncertainty remains, requiring rapid assessment of these products' immunogenicity and safety while addressing the lack of commercial experience with them. Traditional recombinant protein technology can be used to express the spike protein, e.g., Sanofi, Novavax. And although the time to establish cell lines needed for manufacturing is longer than for nucleic acid vaccines, there is a robust commercial experience with protein and protein particle vaccines, including licensed vaccines for hepatitis B, human papillomavirus, varicella zoster, and influenza. Protein vaccines will require a potent adjuvant, which can be critical for inducing a predominantly Th1 type immune response. However, the availability of certain adjuvants may be limited. Viral vector vaccines encode the viral gene of interest into one of several well-characterized vectors, including adenovirus and vesicular stomatitis virus, VSV. The replication-defective adenovirus 26, RAD26, recently shown to be safe and immunogenic in preventing Ebola virus infection. 15, is being developed by Janssen Pharmaceuticals for COVID-19. This platform has the potential to be manufactured at large scale. Pre-existing immunity to the specific viral vector can attenuate immunogenicity, and this needs to be addressed in early-stage trials. A recombinant chimpanzee advector, ChAdOx1, developed by the University of Oxford and AstraZeneca, has also entered clinical trials. Similar versions of ChAd vaccine products have been tested in prior clinical trials and shown to be safe and immunogenic. The VSV vector vaccine platform is replication competent and thus induces a robust, likely durable immune response with a single dose. A licensed VSV Ebola vaccine made by Merck is highly effective after a single dose, although its reactogenicity may be limiting in some populations. These diverse approaches provide the potential for scalable production required for widespread population use. Strategic collaborations under the ACTIV Public-Private Partnership. NIH has partnered with its sister agencies in the Department of Health and Human Services, including the Food and Drug Administration, Centers for Disease Control and Prevention, and Biomedical Advanced Research and Development Authority. Other U.S. government departments, including the Departments of Defense and Veterans Affairs, the European Medicines Agency, and representatives from academia, philanthropic organizations, more than 15 biopharmaceutical companies, and the Foundation for NIH. This forum allows for discussions and consensus on vaccine trial designs, rapid data sharing, and close collaborations between the public and private sectors to rapidly and efficiently conduct vaccine efficacy studies. There is an emerging consensus that vaccine trials need to either use common independent laboratories or contribute samples and data for the purpose of generating surrogate markers that ultimately speed licensure and an overall comparison of efficacy. A common institutional review board as well as a common cross-trial data and safety monitoring board (DSMB) should be used so that the regulatory framework for the entire enterprise is coordinated and the regulatory agencies and the public can make objective assessment of the effect sizes between approaches. As vaccine candidates are poised to enter Phase 1, the collective planning for Phase 3 must be undertaken. Although much of this focus is on trials in the United States, the COVID-19 prevention networks established under the ACTIV program have a global focus and coordination with the World Health Organization, Coalition for Epidemic Preparedness Innovations, and other global philanthropic partners must also occur. Harmonized master protocols will be needed to enable transparent evaluation of the relative effectiveness of each vaccine approach. This harmonization can best be achieved through public-private partnerships, such as ACTIV, in which government-supported central laboratories and independent biostatisticians serve as key resources for efficacy trials, thereby providing a standardized way to assess the relative immune responses of different types of vaccines. See the figure. Such laboratories enhance the ability to define correlates of protection, which would speed licensure for all vaccines as well as define populations that will achieve protective immunity. Data should be shared among companies and be provided to independent statistical evaluation, allowing the early evaluation of a potential surrogate marker of protection, which would markedly speed licensure and distribution.
Such data can only be obtained from harmonization and collaboration early on. During the planning of efficacy trials and the implementation of the collaboration described in the figure, the use of collaborating clinical trial sites, the monitoring of these efficacy trials through a common DSMB, independent statisticians having access to cross-trial data in real time, and centralized immune monitoring laboratories. These innovations in the process of vaccine development are required to achieve the rapid development of the platform technologies entering clinical trials. Global effort, global cooperation, and transparency are needed to maximize the speed, veracity, and decision-making required to deliver scientific advances to the global population in a timely fashion. Models for all of these programs exist, and rapid implementation of these ideas is essential if we are to succeed in the timelines required to return us to pre-COVID-19 social interactions. Scale up. The ability to manufacture hundreds of millions to billions of doses of vaccine requires the vaccine manufacturing capacity of the entire world. Although new technologies and factories can be developed to sustain production, there is an immediate need to fund the necessary biomanufacturing infrastructure, including the fill-finish steps that provide vialed vaccine products for distribution. Cost, distribution system, cold chain requirements, and delivery of widespread coverage are all potential constriction points in the eventual delivery of vaccines to individuals and communities. All of these issues require global cooperation among organizations involved in healthcare delivery and economics. To return to a semblance of previous normality, the development of SARS-CoV-2 vaccines is an absolute necessity. To achieve this goal, all the resources in the public, private, and philanthropic sectors need to participate in a strategic manner. The ACTIV public-private partnership and collaborative harmonized efficacy trials are enabling models to achieve our common goal.
We're doing therapeutics already. Fewer people are dying when they get sick. Far fewer people are dying. We've done a great job. The only thing I haven't done a good job, and that's because of the fake news. No matter what you say to them, they give you bad press on it. It's just fake news. They give you good press. They give me bad press because that's the way it is, unfortunately. But let me just tell you something. I don't care. I've gotten used to it. But I'll tell you, Joe, you could never have done the job that we did. You don't have it in your blood. You could have never done that job.
I know how to do the job. I know how to get the job
Well, you
done.
didn't do very well in swine flu. H1N1, you were a disaster. Your own chief of staff said you were a disaster.
14,000 people died, not 200,000. There was
A
no
very-
economic recession.
Sir, you made a
Far
there
less
was no
lethal
recession.
disease,
You made a
by the way.
point. Let him answer.
And there was no one, we didn't shut down the economy. This is his economy he's shut down. The reason it's shut down is because, look, you folks at home, how many of you got up this morning and had an empty chair at the kitchen table because someone died of COVID? How many of you were in a situation where you lost your mom or dad and you couldn't even speak to them? You had a nurse holding a phone up so you could, in fact, say goodbye.
You would have lost far
How
more
many
people. Far more people.
And
you would have been
And by the way,
months late.
your own,
You were
his
months behind me,
own
Joe.
CDC director says we could lose as many as another 200,000 people between now and the end of the year. And he held up, he said, if we just wear a mask, we can save half those numbers. Just a mask. And by the way, in terms of the whole notion of a vaccine, we're for a vaccine, but I don't trust him at all, nor do you. I know you don't. What we trust is a scientist.
You don't
we
trust
Dr.
Johnson &
Fauci.
Johnson, Pfizer?
And
Okay,
by the way,
gentlemen, let me move on to questions about the future, because you both have touched on two of the questions I'm going to ask. Focusing on the future first, President Trump, you have repeatedly either contradicted or been at odds with some of your government's own top scientists. The week before last, the head of the Centers for Disease Control, Dr. Redfield, said it would be summer before the vaccine would become generally available to the public. You said that he was confused and mistaken. Those were your two words.
Yeah.
But Dr. Slaoui, the head of your Operation Warp Speed, has said exactly the same thing. Are they both wrong?
Well, I've spoken to the companies, and we can have it a lot sooner. It's a very political thing because people like this would rather make it political than save lives. It is a very political thing. I've spoken to Pfizer. I've spoken to all of the people that you have to speak to. We have great Moderna, Johnson & Johnson, and others. They can go faster than that by a lot. Become very political because the left, or I don't know if I call them left, I don't know what I call
the
them.
head of your Operation Warp Speed, Dr. Slaoui?
I disagree with him. Yeah, no, I disagree with both of them. And he didn't say that. He said it could be there, but it could also be much sooner. I had him in my office 2 days ago.
He talked about the summer, sir, before it's generally available. Just like
He said
Dr.
it's a
Redfield.
possibility that we'll have the answer before November 1st. It could also
I'm
be
talking about
after
when it's
that.
generally available. not when it will
We're
be.
going to deliver it right away. We have the military all set up. Logistically, they're all set up. We have our military that delivers soldiers, and they can do 200,000 a day. They're going to be
This
delivering.
is the same man
It's
who
all
told
set
you
up.
by Easter this would be gone away. By the warm weather, it'd be gone. Miraculous, like a miracle. And by the way, maybe you could inject some bleach in your arm, and that would take care of it. This is the same
That was
man.
said sarcastically,
That was
and you
him.
know that.
I
That
know.
was said sarcastically.
And so here's the deal. This man is talking about a vaccine. Every serious company is talking about maybe having a vaccine done by the end of the year. But the distribution of that vaccine will not occur until sometime beginning or the middle of next year to get it out, if we get the vaccine. And pray God we will. Pray God we will.
Mr. Vice President, I want to pick up
You'll have
on
the
that.
vaccine
I
sooner
want to
than
pick
that.
up on this question, though. You say the public can trust the scientists, but they can't trust President Trump. In fact, you said that again tonight. Your running mate, Senator Harris, goes further, saying the public health experts, quote, will be muzzled, will be suppressed. Given the fact that polls already show that people are concerned about the vaccine and are reluctant to take it, are you and your running mate, Senator Harris, contributing to that fear?
No more than the question you just asked him. You pointed out. He puts pressure and disagrees with his own scientists.
But you're saying
Everybody
you can't,
knows.
or Senator
And-
Harris is saying
no,
you can't trust the scientists.
No, you can trust the scientists. She didn't say that. You can't trust
She said the public health
Did say
experts,
that.
quote, will be muzzled, will be suppressed.
Well, that's what he's going to try to do. But there's millions of scientists, there's thousands of scientists out there, like here at this great hospital, that don't work for him. Their job doesn't depend on him. That's not, they're the people, and by
I
the way.
spoke to the
and
scientists that are in
and by
charge.
the way.
They will have
and
the vaccine very
does-
soon.
Let him finish.
Do you believe for a moment what he's telling you in light of all the lies he's told you about the whole issue relating to COVID? He still hasn't even acknowledged that he knew this was happening, knew how dangerous it was going to be back in February, and he didn't even tell you. He's on record as saying it. He panicked or he just looked at the stock market, one of the two, because guess what? A lot of people died. and a lot more are going to die unless he gets a lot smarter, a lot quicker.
So-
Mr. President?
Did you use the word smart? So you said you went to Delaware State, but you forgot the name of your college. You didn't go to Delaware State. You graduated either the lowest or almost the lowest in your class. Don't ever use the word smart with me.
A lot quicker.
So-
Mr. President?
Did you use the word smart? So you said you went to Delaware State, but you forgot the name of your college. You didn't go to Delaware State. You graduated either the lowest or almost the lowest in your class. Don't ever use the word smart with me.
A lot quicker.
So-
Mr. President?
Did you use the word smart? So you said you went to Delaware State, but you forgot the name of your college. You didn't go to Delaware State. You graduated either the lowest or almost the lowest in your class. Don't ever use the word smart with me. Don't ever use that word.
Oh, give me a break.
Because you know what? There's nothing smart about you, Joe. 47 years you've done nothing.
Let's have this debate.
And if-
Give me a break.
Because you know what? There's nothing smart about you, Joe. 47 years you've done nothing.
Let's have this debate.
And if-
Give me a break.
Because you know what? There's nothing smart about you, Joe. 47 years you've done nothing.
Let's have this debate.
And if-
Give me a break.
Because you know what? There's nothing smart about you, Joe. 47 years you've done nothing.
Let's have this debate.
And if
We'll
you
see
would have
who's
had, let me just tell you something, Joe.
No,
If you would have had the charge of what I was put through, I had to close the greatest economy in the history of our country. And by the way, now it's being built again.
see,
and
he's
it's
We're going to
going
get
up
to the
fast.
economy in the next segment, sir.
Okay.
It's going up fast. I look
Okay.
forward to talking.
When it comes to how the virus has been handled so far, the two of you have taken very different approaches, and this is going to affect how the virus is handled going forward by whichever of you ends up becoming the next president. I want to quickly go through several of those. Reopenings. Vice President Biden, you have been much more reluctant than President Trump about reopening the economy and schools. Why, sir?
Because he doesn't have a plan. If I were running, I'd know what the plan is. You've got to provide these businesses the ability to have the money to be able to reopen with the PPE as well as with the sanitation they need. You have to
Tell
provide
that
them
to Nancy
plastic.
Pelosi.
Well, he's just shush for a minute.
Tell it to Nancy Pelosi. And Schumer,
by the
Brian
way,
Chuck.
Nancy Pelosi and Schumer, they have a plan. He won't even meet with them. The Republicans won't meet with him in the
Okay.
Senate.
But-
And he sits on his golf course. And I mean, literally, think about it.
You probably
Or
play
think
more than
about
I
it.
do, Joe.
What about this question of reopenings and the fact?
Well, he wants to shut down this country, and I want to keep it open. And we did a
he
great thing
just
by
admitted
shutting
he
it
shut
down.
it down.
Wait a minute,
Let
Joe.
him
Let me
finish,
shut
sir.
you down for a second, Joe, just for 1 second. He wants to shut down the country. We just went through it. We had to because we didn't know anything about the disease. Now we found that elderly people with heart problems and diabetes and different problems are very, very vulnerable. We learned a lot. Young children aren't. Even younger people aren't. We've learned a lot. But he wants to shut it down. More people will be hurt by continuing. If you look at Pennsylvania, if you look at certain states that have been shut down, they have Democrat governors all. One of the reasons they're shut down is because they want to keep it shut down until after the election on November 3rd.
I want to move on to another
because
subject.
it's a
I want to move
political
on to
thing.
another
I
subject.
gotta respond to that.
I
But
want to
those
move,
states,
gentlemen, I
those
want to move
states
on to
are
another
not
subject.
doing well that are shut down
Which is
right
gotta
now.
respond to that.
Wants
President
to shut
Trump,
down the
you
whole
have
country.
begun to increasingly question the effectiveness of masks as a disease preventer. And in fact, recently you have cited the issue of waiters touching their masks and touching plates. Are you questioning
No, I think
the
masks
efficacy
are
of
okay. You have
masks?
to understand, if you look, I mean, I have a mask right here. I put a mask on, when I think I need it. Tonight, as an example, everybody's had a test, and you've had social distancing and all of the things that you have to. But I
Just
wear
like your
masks
rallies.
when needed. When needed, I wear masks.
Okay, let me ask.
I don't wear masks like him. Every time you see him, he's got a mask. He could be speaking 200 feet away from it. He shows up with the biggest mask I've ever seen. I will say
Vice President Biden, go ahead, sir.
Look, the way to open businesses is give them the wherewithal to be able to open. We provided money. The Congress.
But I was asking you, sir, about masks.
Well, masks make a big difference. His own head of the CDC said if we just wore masks between now, everybody wore masks in social distance between now and January, we'd probably save up to 100,000 lives. It matters.
And they've also
It
said the
matters.
opposite. They've also said
no serious person said the opposite.
They've
No
also said, well, look
serious
all right, I
at
wanna
Dr.
ask you-
Fauci. Dr. Fauci said the
He
opposite.
did not
I
say
want to
the
ask you, we
opposite.
got a
said
little
very
bit more than
strongly,
a minute left in this
masks
segment.
are not good. Then he changed his mind. He said masks good.
I
I'm
wanna
okay
ask-
with masks.
I
I'm
want to
not
ask you
fighting
both about
masks.
one last subject, because your different approaches has even affected the way that you have campaigned. President Trump, you're holding large rallies with crowds packed together, thousands of people.
Outside.
Outside, yes, sir, agreed. Vice President Biden, you are holding much smaller events with...
Because nobody will show up.
People with...
Well, it's true. Nobody shows up to his rallies.
All right. In any case, why you holding the big rallies? Why you not? You goes first, sir.
Because people want to hear what I have to say. I mean,
But are you
I've
not
done a
worried
great
about it
job
spreading
as a
disease?
president, and I'll have 35,000 people show up at airports. We use airports.
Are you
and
not worried
hangars,
about
and we
the
have a
disease
lot of
issue,
people.
sir?
Well, so far we have had no problem whatsoever. It's outside. That's a big difference, according to the experts. And we do them outside. We have tremendous crowds, as you see. I mean, and literally on 24 hours notice. And Joe does the circles and has 3 people someplace.
Okay.
By the way, did you see
sir.
one of the last big rallies he had? And a reporter came up to him to ask him a question. He said, no, stand back. Put on your mask. Put on a mask. Have you been tested? I'm way far away from those other people. That's what he said. I can't. I'm going to be okay. He's not worried about you. He's not worried about the people out there breathing in one another.
We've had no negative
cheek to
effect.
jowl.
Experience the rewards of our curiosity.
We reported in the middle of the program about Herman Cain, a Trump surrogate and a prominent Republican, a former presidential candidate. He has now died of the coronavirus at the age of 74. That is according to a statement posted on his website, which says that Cain was in a high-risk group because of his history with cancer. He had tested positive more than a week after attending President Trump's Tulsa rally back in June. While there's no way to pinpoint exactly where he contracted the virus, he posted a photo of himself with others at the event, which showed him also without a mask. For more on the death of Herman Cain, I am joined on the phone by NBC News' Kelly O'Donnell, who covered that rally that day. Kelly, let me get your initial thoughts about this tragic news of the passing of Herman Cain. Kelly, are you able to hear me? Okay.
Hi, Eamon. I'm sorry.
Yeah, sorry. Kelly, good to hear you. Okay, so Kelly, let me just pick up on what I was asking you there. We were laying the context of the passing of Herman Cain. Obviously, you covered that rally in Tulsa. We don't know for a fact where he may have contracted that virus, but just put in context for us his tragic death.
Herman Cain is someone who has been so prominent in the business and political world over many years, and it is certainly a terrible loss for his family and his staff. And of course, it stands out that he has been a friend to the president and was in attendance and was photographed at the Tulsa rally, which was the last rally the president held, and one that was happening in what was at that time a COVID hotspot. Herman Cain was photographed wearing a mask, sitting in close proximity to others. Of course, we don't have an ability to draw a line from that event to his diagnosis. That's just some of the background of what has happened here. He had been hospitalized since early July, and there were periodic updates from his team, and there were some signs of hopefulness. But as they reported his passing at age 74 today, they described the fact that they just were not able to get him past that point, even though only days ago they write that he had some indications of being able to recover. That, I guess, is the nature of how grievous this sort of illness can be. And he was largely in good condition, they say, other than that, not experiencing a lot of other health problems. But the impact he made as a CEO of Godfather's Pizza, as a 2012 presidential candidate, a former chairman of the Kansas City Federal Reserve Board, he had a big impact in his business life and his political life, and was a friend of the president, and of course had a more traditional political Republican experience before the era of Trump. Running in 2012, he might not have been a precursor to the Trump era, but he became famous for something known as 999. His idea for a new tax level that would set the rate at 9% if you were an individual or a business and so forth. And that became one of the calling cards of his 2012 presidential campaign. And there was a period, Eamon, when he was the front runner of that race, when it was a crowded field early on. So his passing today comes as a bit of a shock because while we know this disease can be so absolutely serious, we had gotten some indications from his staff as they were tweeting some updates that he was making progress. We had not heard of this later turn, and they write about the fact that they didn't feel that there was necessity to update everyone as things grew more serious. So the loss of Herman Cain is a shock.
Right.
One question it will raise is, will it have an impact on the president? Is this something that he will speak about because they were friends? And certainly Herman Cain had advocated for the president on many occasions.
No negative effect.
We've had no negative effect, and we've had 35, 40,000 people at these rallies.
Just quickly finish up because I want to move on to our next.
Yes, I would. He's been totally irresponsible the way in which he has handled the social distancing and people wearing masks, basically encouraged them not to.
All right.
He's a fool on this.
If you could get the crowds, you would have done the same thing. But you can't. Nobody cares.
Gentlemen, can we move on to the
cares.
Gentlemen, can we move on to the economy?
Yes.
The economy is, I think it's fair to say, recovering faster than expected from the shutdown.
Much faster.
In the second quarter, the unemployment rate fell to 8.4% last month. The Federal Reserve says the hit to growth, which is going to be there, is not going to be nearly as big as they had expected. President Trump, you say we are in a V-shaped recovery. Vice President Biden, you say it's more of a K-shape. What difference does that mean to the American people in terms of the economy? President Trump, in this segment, you go first.
So we built the greatest economy in history. We closed it down because of the China plague. When the plague came in, we closed it down, which was very hard psychologically to do. He didn't think we should close it down, and he was wrong. And again, 2 million people would be dead now instead of still 204,000 people is too much. One person is too much. Should have never happened from China. But what happened is we closed it down, and now we're reopening, and we're doing record business. We had 10.4 million people in a 4-month period that we've put back into the workforce. That's a record the likes of which nobody's ever seen before. And he wants to close down he will shut it down again. He will destroy this country. You know, a lot of people, between drugs and alcohol and depression, when you start shutting it down, you take a look at what's happening in some of your Democrat-run states where they have these tough shutdowns. And I'm telling you, it's because they don't want to open it. One of them came out last week. You saw that. Oh, we're going to open up on November 9th. Why November 9th? Because it's after the election. They think they're hurting us by keeping them closed. They're hurting people. People know what to do. They can social distance. They can wash their hands. They can wear masks. They can do whatever they want. But they got to open these states up. When you look at North Carolina, when you look, and these governors are under siege, Pennsylvania, Michigan, and a couple of others, you got to open these states up. It's not fair. You're talking about almost it's like being in prison. And you look at what's going on with divorce, look at what's going on with alcoholism and drugs. It's a very, very sad thing. And he'll close down the whole country. This guy will close down the whole country and destroy our country. Our country is coming back incredibly well, setting records as it does it. We don't need somebody to come in and say, let's shut it down.
All right. Your 2 minutes, sir. We're now moved to you. As I said, posing the question, the president says it's a V-shaped recovery. You say it's a K-shaped recovery. What's the difference?
The difference is millionaires and billionaires like him in the middle of the COVID crisis have done very well. Billionaires have made another $300 billion because of his profligate tax proposal, and he only focused on the market. But you folks at home, you folks living in Scranton and Claymont and all the small towns and working class towns in America, how well are you doing? This guy paid a total of $750 in taxes.
Sir, wait, no, sir, it's just
wrong
yeah, I understand. You've agreed to the 2 minutes, so please let him have it.
Do I get my time back? The fact is that he has, in fact, worked on this in a way that he's going to be the first president of the United States to leave office having fewer jobs in his administration than when he became president. Fewer jobs than when he became president. First one in American history. Secondly, the people who have lost their jobs are those people who have been on the front lines, those people who have been saving our lives, those people who have been out there dying, people who've been putting themselves in the way to make sure that we could all try to make it. And the idea that he is insisting that we go forward and open when you have almost half the states in America with a significant increase in COVID deaths and COVID cases in the United States of America. And he wants to open it up more. Why does he want to open it up? Why doesn't he take care of the American? You can't fix the economy until you fix the COVID crisis. And he has no intention of doing anything about making it better for you all at home in terms of your health and your safety. Schools, why aren't schools open? Because it costs a lot of money to open them safely. You know, they were going to give, his administration was going to give the teachers and school students masks. And then they decided, no, couldn't do that because it's not a national emergency. Not a national emergency. They've done nothing to help small businesses. Nothing. They're closing. 1 in 6 is now gone. He ought to get on the job and take care of the needs of the American people so we can open safely.
All right. Your time is up, sir. Well, we are going to get to...
I have to respond to that.
Well, you both had 2 minutes, sir.
Excuse me, he made a statement.
So did you.
People want their schools, people want their schools open. They don't want to be shut down. They don't want their state shut down. They want their restaurants. I look at New York. It's so sad what's happening in New York. It's almost like a ghost town. And I'm not sure it can ever recover what they've done in New York. People want their places open. They want to get back to their lives. They'll be careful, but they want their schools open. I'm the one that brought back football. By the way, I brought back Big Ten football. It was me, and I'm very happy to do it. I'm the one that brought back football. By the way, I brought back Big Ten football. It was me, and I'm very happy to do it. I'm the one that brought back football. By the way, I brought back Big Ten football. It was me, and I'm very happy to do it. I'm the one that brought back football. By the way, I brought back Big Ten football. It was me, and I'm very happy to do it. And
all right,
people of Ohio are very proud of me. And you know how I found out? When he took the phony ad.
Gentlemen, we're going to get to your economic plans going forward in a moment. But first, Mr. President, as you well know, there's a new report that in 2016, the year you were elected president, and 2017, your first year as president, that you paid $750 a year in federal income tax each of those years. I know that you pay a lot of other taxes, but I'm asking you the specific question. Is it true that you paid $750 in federal income taxes each of those 2 years?
I paid millions of dollars in taxes, millions of dollars of income tax. And let me just tell you, there was a story in one of the papers. I paid $38 million 1 year. I paid $27 million.
Show us your tax
1 year.
returns.
I went. You'll see it as soon as it's finished. You'll see it. You know, if you want to go to the Board of Elections. There's a 118-page or so report that says everything I have, every bank I have, I'm totally under-leveraged because the assets are extremely good. And I built a great company.
I'm asking you a specific question, which is...
But let me tell you...
I understand all of that. I understand all of that. No, Mr. President.
Go ahead.
I'm asking you a question. Will you tell us how much you paid in federal income taxes in 2016 and 2017?
Millions of dollars.
You paid millions of dollars?
Millions of dollars,
So
yes.
not $750?
Millions of dollars, and you'll get to see it. And you'll get to see it. But let me just tell you, Chris, let me just tell you something, that it was the tax laws. I don't want to pay tax. Before I came here, I was a private developer. I was a private business people. Like every other private person, unless they're stupid, they go through the laws, and that's what it is.
Is it true that you paid $750 in federal income taxes each of those 2 years?
I paid millions of dollars in taxes, millions of dollars of income tax.
Will you tell us how much you paid in federal income taxes in 2016 and 2017?
Millions of dollars.
You paid millions of dollars?
Millions of dollars,
So
yes.
not $750?
Millions of dollars, and you'll get to see it. And you'll get to see it. But let me just tell you, Chris, let me just tell you something, that it was the tax laws. I don't want to pay tax. Before I came here, I was a private developer. I was a private business people. Like every other private person, unless they're stupid, they go through the laws, and that's what it is.
Is it true that you paid $750 in federal income taxes each of those 2 years?
I paid millions of dollars in taxes, millions of dollars of income tax.
Will you tell us how much you paid in federal income taxes in 2016 and 2017?
Millions of dollars.
You paid millions of dollars?
Millions of dollars.
So
yes.
not $750?
Millions of dollars, and you'll get to see it. And you'll get to see it. But let
And
me just
Shala?
tell you, Chris, let me just tell you something, that it was the tax laws. I don't want to pay tax. Before I came here, I was a private developer. I was a private business people. Like every other private person, unless they're stupid, they go through the laws, and that's what it is.
Is it true that you paid $750 in federal income taxes each of those 2 years?
I paid millions of dollars in taxes, millions of dollars of income tax.
Will you tell us how much you paid in federal income taxes in 2016 and 2017?
Millions of dollars.
You paid millions of dollars?
Millions of dollars.
So
yes.
not 750.
Millions of dollars, and you'll get to see it. And you'll get to
when?
see it. But let
And
me just
Shala?
tell you, Chris, let me just tell you something, that it was the tax laws. I don't want to pay tax. Before I came here, I was a private developer. I was a private business people. Like every other private person, unless they're stupid, they go through the laws, and that's what it is. He passed a tax bill that gave us all these privileges for depreciation and for tax credits. We build a building and we get tax credits, like the hotel on Pennsylvania Avenue. You get a massive, which, by the way, was given to me by the Obama administration, if you can believe that. Now, the man got fired right after that happened. But
Vice President Biden, you want to respond?
Yeah, I do want to respond. Look, the tax code that made him, put him in a position that he pays less tax than a school teacher makes on the money a school teacher makes, is because of him he says he's smart because he can take advantage of the tax code. And he does take advantage of the tax code. That's why I'm going to eliminate the Trump tax cuts. And I'm going to eliminate those tax cuts and make sure that we invest in the people who, in fact, need the help. People out there need help.
But why didn't you do it over the last 25 years?
Because you weren't president. Because you weren't president screwing things up.
You were a senator. And
You're
by
the
way,
worst
you were a
president
vice-
America has ever had.
Hey,
Come
Joe,
on.
let me. Why didn't you do it over the last 25 years?
Because you weren't president. Because you weren't president screwing things up.
You were a senator. And
You're
by
the
way,
worst
you were a
president
vice-
America has ever had.
Hey,
Come
Joe,
on. You're the worst president America has ever had.
Hey,
Come
Joe,
on. You're the worst president America has ever had.
Hey,
Come
Joe,
on.
You're
the worst president America has ever had.
Hey,
Come
Joe,
on. You're the worst president America has ever had.
Hey,
Come
Joe,
on. You're the worst president America has ever had.
Hey,
Come
Joe,
on. You're the worst president America has ever had.
Hey,
Come
Joe,
on.
You're
the worst president America has ever had.
Hey,
Come
Joe,
on. You're the worst president America has ever had.
Hey,
Come
Joe,
on.
let me just tell you, Joe, I've done more in 47 months. I've done more than you've done in 47 years, Joe. We've done things that you never even thought of doing, including fixing the broken military that you gave me, including taking care of your vets.
Mr. President, we're talking about the economy. I'd like to ask you about your plans going forward, because, Mr. Vice President, your economic plan, if you were to be elected president, focuses a lot on big government, big taxes, big spending. I want to focus first on the taxes. You propose more than $4 trillion over a decade in new taxes on individuals making more than $400,000 a year and on corporations. President Trump says that that kind of an increase in taxes is going to hurt the economy as it's just coming out of a recession.
Well, just take a look at what is the analysis done by Wall Street firms. Points out that my economic plan would create 7 million more jobs than his in 4 years, number one. And number two, it would create an additional $1 trillion in economic growth, because it would be about buying American. That we're going to make the federal government spend $600 billion a year on everything from ships to steel to buildings and the like. And under my proposal, we're going to make sure that every penny of that has to be made by a company.
But respectfully, sir, I'm talking about taxes, not spending.
By the way, I'm going to eliminate a significant number of the tax. I'm going to make the corporate tax 28%. It shouldn't be 21%. You have 91 companies, in the Fortune 500, who don't pay a single penny in tax, making billions of dollars.
Why didn't you do it before when you were vice president with Obama?
Because you, in fact, passed that. That was
right.
your tax proposal.
I got it done. And you know what happened?
You got it done.
Our economy boomed like it's never boomed
The economy is busted.
Mr. President,
Let me finish.
Mr. President, let me pick up on that. You would continue your free market approach, lower taxes, more deregulation, correct?
Not lower taxes for the American people.
But let me,
Excuse me.
But in Obama's, you talk about the economy booming, it turns out that in Obama's final 3 years as president, more jobs were created, 1.5 million more jobs than in the first 3 years of your presidency.
They had the slowest recovery economic recovery since 1929. It was the slowest recovery. Also, they took over something that was down here. All you had to do is turn on the lights and you pick up a lot. But they had the slowest economic recovery since 1929. Let me tell you about the stock market. When the stock market goes up, that means jobs. It also means 401ks. If you got in, if you ever became president with your ideas, you want to terminate my taxes, I'll tell you what, you'll lose half of the companies that have poured in here will leave, and plenty of companies that are already here, they'll leave for other places. They will leave, and you will have a depression, the likes of which you've never seen.
Look, we inherited the worst recession short of a depression in American history. I was asked to bring it back. We were able to have an economic recovery that created the jobs you're talking about. We handed him a booming economy. He blew it.
It wasn't
booming.
Blew
He
it.
blew it.
It wasn't booming. It was the weakest recovery since 1929.
Is it fair to say he blew it when, in fact, when there was record low unemployment before COVID?
Yeah, but because what he did, even before COVID, manufacturing went in the hole. Excuse
me,
one.
Chris. Wait.
Number two.
Chris.
Number three.
They said it would take. No, you were number two.
No.
Chris. They said it would take a miracle to bring back manufacturing. I brought back 700,000 jobs. They brought back nothing. They gave up on manufacturing. Part of my standard fare.
I'm the guy that brought back the automobile industry.
All right, let him.
We brought back. I was asked to bring back Chrysler and General Motors. We brought them back right here in the state of Ohio and Michigan. He blew it. They're gone. He blew it. And in fact, they're going.
Ohio had the best year it's ever had last year. Michigan had the best year they've ever had.
That is not
Many
true.
car companies came in from Germany, from Japan, went to Michigan, went to Ohio.
They're not having.
And they didn't come in with you.
Mr. Vice President, go ahead.
And so you take a look at what he's actually done. He's done very little. His trade deals are the same way. He talks about these great trade deals. You know, he talks about the art of the deal. China's perfected the art of the steal. We have a higher deficit with China now than we did before. We have the highest trade deficit
China
with
ate
Mexico.
your lunch.
All right, gentlemen.
China ate your lunch, Joe. And no wonder your son goes in and he takes out billions of dollars. Takes out billions of dollars to manage. He makes millions of dollars. And also, while we're at it, why is it, just out of curiosity, the mayor of Moscow's wife gave your son $3.5 million. What did he do to deserve it? What did he do with Burisma to deserve $183,000?
None of that is true.
Let him answer.
None of that is true.
Oh, really? He didn't get $3.5 million?
Mr. President,
Mr.
President, please.
Totally discredited. Totally discredited. And by the way,
well, wait, he didn't get $3.5 million, Joe?
Mr. Vice,
he got $3.5 million.
It is not true.
Oh, really?
Mr. President, it's an open discussion, please.
It's a fact.
Well, you have raised an issue. Let the Vice President answer.
Discredited.
Did Burisma pay him $183,000 a month with no experience in energy?
Mr. President,
my son did nothing wrong at Burisma.
I think he did.
Mr. President, let him answer.
He doesn't want to let me answer because he knows I have the truth. His position has been totally, thoroughly discredited.
By who?
And you
the media?
By everybody. Well, by the media, by our allies, by the World Bank, by everyone has discredited. Matter of fact, even the people who testified under oath.
So let me ask you this, Joe.
No, go ahead, Mr. I'm listening to you.
The people
he got $3.5 million from Moscow.
He testified under oath in his administration, said, I did my job and I did it very well.
Oh,
I
really?
did it
I'd
honorably.
like to know who they are.
Well, I'll give you the list of the people who testified.
No, go ahead, sir.
Sure, you've already fired most of them because they did a good job.
Some people don't do a good job. With you,
go ahead. Wait a minute. You get the final word, Mr.
Well, it's hard to get any word in with this clown. Excuse me.
Hey, let me just say, Joe.
No. Mr. President.
$3.5 million, Joe.
That is simply
Why did he deserve $3.5 million from Moscow?
Look, here's the deal. We want to talk about families and ethics. I don't want to do that. I mean, his family we could talk about all night. His family's already...
My family lost a fortune by
That's
coming down and helping us with government.
And that's such a...
Mr. President.
Every single one of them lost
This
a
is not
fortune
about
by
my
coming and
family or his
helping us
family.
with
It's
government.
about your family,
They
the
didn't
American
collect $3.5
people.
million
He
for
doesn't...
nothing.
That's not true. It doesn't want to talk about what you need. You, the American people. It's about you. That's what we're talking about here.
All right, that's
Not
the,
about
end
here.
of, that's the end of the segment. We're moving on.
He didn't take them.
Well,
Vice
it's a very-
President,
but Chris,
no.
can I be honest? It's a very important
Try to be
question.
honest.
He stood up.
No,
He stood up,
the answer to
and
the
he
question is no.
threatened Ukraine.
No, sir.
With $1 billion, if you
that
don't get rid
is
of Russia.
absolutely
You know what? Wait,
not
stop.
true.
You're on tape doing it.
You're going to
Not
have...
True.
Gentlemen, I hate to raise
Chris,
my voice, but
he's
I think it
on
seems to be, why should I be different than the two of you? So here's the
That's a
deal.
good point.
We have 6 segments. We have ended that segment. We're going to go to the next segment. In that segment, you each are going to have 2 uninterrupted moments. In those 2 uninterrupted minutes, Mr. President, you can say anything you want. I'm going to ask a question about race, but if you want to answer about something else, go ahead. But I think that the country would be better served if we allowed both people to speak with fewer interruptions. I'm appealing to you, sir, to do that.
Well, and him too.
Well, frankly, you've been doing more interrupting
Well, that's
than he
all right,
has.
but he does plenty.
Well, less than, sir, less
there's
than,
plenty.
no, less than you have. Let's please continue on. The issue of race. Vice President Biden, you say that President Trump's response to the violence in Charlottesville 3 years ago, when he talked about very fine people on both sides, was what directly led you to launch this run for president.
Oh, yeah, sure.
President Trump, you have often said that you believe you have done more for Black Americans than any president, with the possible exception of Abraham Lincoln. My question for the two of you is, why should voters trust you rather than your opponent to deal with the race issues facing this country over the next 4 years? Vice President Biden, you go first.
It's about equity and equality. It's about decency. It's about the Constitution. And we have never walked away from trying to require equity for everyone, equality for the whole of America. But we've never accomplished it. But we've never walked away from it like he has done. It is true. The reason I got in the race is when those people, close your eyes, remember what those people look like coming out of the fields carrying torches, their veins bulging, just spewing anti-Semitic bile, and accompanied by the Ku Klux Klan. A young woman got killed. And they asked the president what he thought. He said there were very fine people on both sides. No president has ever said anything like that.
It is whose
Now,
minutes, sir.
second point I'd make to you is that when Floyd was killed, when Mr. Floyd was killed, there was a peaceful protest in front of the White House. What did he do? He came out of his bunker, had the military use tear gas on him so he could walk across to a church and hold up a Bible. And then what happened after that? The bishop of that very church said that it was a disgrace. The general who was with him said all he ever wants to do is divide people, not unite people at all. This is a president who has used everything as a dog whistle to try to generate racist hatred, racist division. This is a man who, in fact, you talk about helping African Americans. 1 in 1,000 African Americans has been killed because of the coronavirus. And if he doesn't do something quickly, by the end of the year, 1 in 500 will have been killed. 1 in 500 African Americans. This man is the savior of African Americans. This man cares at all. This man's done virtually nothing. Look, the fact is that you have to look at what he talks about. You have to look at what he did. And what he did has been disastrous for the African-American community.
So,
President Trump, you have 2 minutes. Why should Americans trust you over your opponent to deal with racism?
he did a crime bill, 1994, where you call them super predators, African Americans, the super predators, and they've never forgotten it. They've never forgotten it, Joe.
No, sir, it's his 2 minutes.
So you did that, and they call you super predator, and I'm letting people out of jail now that you have treated the African American population community, you have treated the black community about as bad as anybody in this country. You did the 1990, and that's why, if you look at the polls, I'm doing better than any Republican has done in a long time, because they saw what you did. You call them super predators, and you've called them worse than that. because you look back at your testimony over the years, you've called them a lot worse than that. As far as the church is concerned, and as far as the generals are concerned, we just got the support of 250 military leaders and generals, total support. Law enforcement, almost every law enforcement group in the United States. I have Florida, I have Texas, I have Ohio, I have Portland. The sheriff just came out today and he said, I support President Trump. As far as the church is concerned, and as far as the generals are concerned, we just got the support of 250 military leaders and generals, total support. Law enforcement, almost every law enforcement group in the United States. I have Florida, I have Texas, I have Ohio, I have Portland. The sheriff just came out today and he said, I support President Trump.
Donald Trump has made my job a hell of a lot harder since he started talking about Portland, but I never thought he'd try to turn my wife against me. Hashtag Portland Sheriff, #debates 2020, #debate night. In tonight's presidential debate, the president said the Portland sheriff supports him. As the Multnomah County Sheriff, I have never supported Donald Trump and will never support him.
I don't think you have any law enforcement. You can't even say the word law enforcement, because if you say those words, you're going to lose all of your radical left supporters. And why aren't you saying those words, Joe? Why don't you say the words law enforcement? Because you know what? If they called us in Portland, we would put out that fire in a half an hour, but they won't do it because they're run by radical left Democrats. If you look at Chicago, if you look at any place you want to look, Seattle, they heard we were coming in the following day and they put up their hands and we got back Seattle. Minneapolis, we got it back, Joe, because we believe in law and order, but you don't. The top 10 cities and just about the top 40 cities are run by Democrats and in many cases radical left. And they've got you wrapped around their finger, Joe, to a point where you don't want to say anything about law and order. And I'll tell you what, the people of this country want and demand law and order, and you're afraid to even say it.
All right. I want to return to the question of race. Vice President Biden, after the grand jury in the Breonna Taylor case decided not to charge any of the police with homicide, you said it raises the question, quote, whether justice could be equally applied in America. Do you believe that there is a separate but unequal system of justice for blacks in this country?
Yes, there is. There's systemic injustice in this country, in education and work and in law enforcement and the way in which it's enforced. But look, the vast majority of police officers are good, decent, honorable men and women. They risk their lives every day to take care of us. But there are some bad apples. And when they occur, when they find them, they have to be sorted out. They have to be held accountable. They have to be held accountable. And what I'm going to do as President of the United States is call together an entire group of people at the White House, well, everything from the civil rights groups to the police officers, to the police chiefs, and we're going to work this out. We're going to work this out so we change the way in which we have more transparency in when these things happen. These cops aren't happy to see what happened to George Floyd. These cops aren't happy to see what happened to Breonna Taylor. Most don't like it. But we have to have a system where people are held accountable. And by the way, violence in response is never appropriate. Never appropriate. Peaceful protest is. Violence is never appropriate.
All right.
What is peaceful protest? When they run through the middle of a town and burn down your stores and kill people all over the place, and you say peaceful protest?
President Trump,
No, it's
I'm not
not,
asking.
but you say it is.
President Trump, I'd like to continue with the issue of race. I promise we're going to get to the issue of law and order in a moment. This month, your administration directed federal agencies to end racial sensitivity training that addresses white privilege or critical race theory. Why did you decide to do that, to end racial sensitivity training? And do you believe that there is systemic racism in this country, sir?
I ended it because it's racist. I ended it because a lot of people were complaining that they were asked to do things that were absolutely insane, that it was a radical revolution that was taking place in our military, in our schools, all over the place, and you know it, and so does everybody else. And he would know.
What is radical about racial sensitivity training, sir?
If you were a certain person you had no status in life. It was sort of a reversal. And if you look at the people, we were paying people hundreds of thousands of dollars to teach very bad ideas and, frankly, very sick ideas. And really, they were teaching people to hate our country. And I'm not going to do that. I'm not going to allow that to happen. We have to go back to the core values of this country. They were teaching people that our country is a horrible place, it's a racist place, and they were teaching people to hate our country. And I'm not going to allow that to happen.
Vice President Biden?
Nobody's doing that. He's the racist.
You just don't know.
Here's the deal. I know a lot more about this than he does.
Let him finish.
The fact is that there is racial insensitivity. People have to be made aware of what other people feel like, what insults them, what is demeaning to them. It's important that people know they don't want to. Many people don't want to hurt other people's feelings, but it makes a big difference. It makes a gigantic difference in the way a child is able to grow up and have a sense of self-esteem. It's a little bit like how this guy and his friends look down on so many people. They look down their nose on people like Irish Catholics like me and grew up in Scranton. They look down on people who don't have money. They look down on people who are of a different faith. They look down on people who are a different color. In fact, we're all Americans. The only way we're going to bring this country together is bring everybody together. There's nothing we cannot do if we do it together. We can take this on and we can defeat racism in America.
President Trump, sir.
During the Obama-Biden administration, there was tremendous division. There was hatred. You look at Ferguson, you go to many places. Look at Oakland. Look what happened in Oakland. Look what happened in Baltimore. Look what happened. Frankly, it was more violent than what I'm even seeing now.
Oh, my
but
Lord.
the reason is that
ridiculous.
the Democrats that run these
Absolutely
cities
ridiculous.
don't want to talk like you about law and order.
Violent
and you
crime,
still haven't mentioned.
violent
Are you
crime.
in favor of law and order?
I'm in favor of law. You follow it.
Are you in favor of law and order? Go
yes,
ahead,
I'm
say
in
it.
favor.
You
Everybody's
asked a
in favor
question,
of
let him finish.
Law and order.
lose his
Law
lefty.
and
Let
order.
him- let him answer.
Law and order with justice, where people get treated fairly. Okay. And the fact of the matter is, violent crime went down 15% in our administration.
All right.
It's gone up on his watch.
Went down much more
he
in
had,
ours.
All right, we're now.
is president of the
Mr. President,
United
you're going
States
to.
of America.
We
Mr.
were
President,
breaking every record in the
Mr.
book.
President, you're going to be very happy because
And
we're now going to talk about law and order.
Places we had trouble were Democratic-run cities.
That's
and
exactly
so-
my question.
Democratic-
There has been a dramatic increase in homicides in America this summer, particularly, and you often blame that on Democratic mayors and Democratic governors, but in fact, there have been equivalent spikes in Republican-led cities like Tulsa and Fort Worth. So the question is this really a party issue?
I think it's a party issue. You can bring in a couple of examples, but if you look at Chicago, what's going on in Chicago, where 53 people were shot and 8 died, shot. If you look at New York, where it's going up like nobody's ever seen anything, the numbers are going up 100, 150, 200%. Crime. It is
cities.
crazy what's going on. And he doesn't want to say law and order because he can't, because he'll lose his radical left supporters. And once he does that, it's over with. But if he ever got to run this country and they ran it the way he would want to run it, we would have our suburbs would be gone. By the way, our suburbs would be gone, and you would see problems like you've
He
never
would
seen.
know a suburb unless he took a wrong turn.
Oh, I know suburbs.
He would not.
So much
I was
better.
raised,
Go ahead.
I was,
Wait a minute.
I was
So much
raised in the suburbs. This is not 1950. All these dog whistles and racism don't work anymore. Suburbs are by and large integrated. There's many people today driving their kids to soccer practice and or to black and white and Hispanic in the same car as there have been any time in the past. What really is a threat to the suburbs and their safety is his failure to deal with COVID. They're dying in the suburbs. His failure to deal with the environment. They're being flooded. They're being burned out because his refusal to do anything. That's why the suburbs are in trouble.
I do want to talk about this issue of law and order, though. And in the joint recommendation that came from the Biden-Bernie Sanders task force, you talked about, quote, reimagining policing. First of all, what does reimagining policing mean, and do you support?
It means.
Let me, if I might finish the question. What does reimagining policing mean, and do you support the Black Lives Matter call for community control of policing?
Look, what I support is the police having the opportunity to deal with the problems they face. And I'm totally opposed to defunding the police offices. As a matter of fact, local police, the only one defunding it. His budget calls for a $400 million cut in local law enforcement assistance. They need more assistance. They need, when they show up for a 9/11 call, to have someone with them as a psychologist or psychiatrist to keep them from having to use force and be able to talk people down. We have to have community policing like we had before, where the officers get to know the people in the communities. That's when crime went down. It didn't go up, it went down. And so we have to be engaged.
That's not what
in
they're
prevention.
talking about, Chris. That's not what they're talking about.
That's
He's talking
exactly,
about defunding the police.
That is not true.
He doesn't have any law support.
Look,
he has no law enforcement
that's not
support.
true.
Almost
That's
nothing.
Look.
Oh, really? Who do you have? Name one group that supports you. Name one group that came out and supported you. Go ahead. Think. We have time.
We don't have time to do anything.
No, think
All right.
about it.
Right,
Name
folks,
one law enforcement group that came out and
I
supported
think, gentlemen,
you,
I think
Joe.
I'm going to take back the
There aren't.
moderator's
I don't
role,
think there
and
are any.
I want to get to another subject, which is the issue of protests in many cities that have turned violent. In Portland, Oregon, especially, we had more than 100 straight days of protests, which I think you would agree. You talk about peaceful protests. Many of those turned into riots. Mr. Vice President, you say that people who commit crimes should be held accountable. The question I have, though, is, as the Democratic nominee, and earlier tonight you said that you are the Democratic Party right now, have you ever called the Democratic mayor of Portland or the Democratic governor of Oregon and said, hey, you got to stop this, bring in the National Guard, do whatever it takes, but you stop the days and months of violence in Portland?
I don't hold public office now. I am a former vice president. I've made it clear in my public statements that the violence should be prosecuted. It should be prosecuted, and anyone who commits it.
But
should
you've
be
never
prosecuted.
called for the people, the leader. Excuse me, sir. You had never called for the leaders in Portland and in Oregon to bring in the National Guard and knock off 100 days of riots.
They can, in fact, take care of it if he just stay out of the way. Look here.
Oh, really?
Really? Here's the thing.
I sent in the U.S. Marshals to get the killer of the young man in the middle of the street. They shot him, and for 3 days,
President Trump,
Portland wouldn't do anything. I had to send in the U.S. Marshals. They took care of business.
Go ahead, sir.
And by the way, his own former spokesperson said, riots and chaos and violence help his cause. That's what this is all about.
I don't know who said that.
I do.
Who?
I think Kellyanne Conway.
I don't think she said that.
She said that. And so here's the But here's the point. The point is that that's what he keeps trying to rile everything up. He doesn't want to calm things down. Instead of going in and talking to people and saying, let's get everybody together, figure out how to deal with this. What's he do? He just pours gasoline in the fire constantly, and every single solitary time.
And to end this, button up this segment, I'm going to give you a minute to answer, sir. You have repeatedly criticized.
Wait, I have to answer his statement.
No, you have
His
repeatedly.
statement. Wait,
you have
just 1
No,
second.
you've been talking back
You made
and
a
forth.
statement.
I'm asking you.
I would love to end it.
Sir.
I would love to end it. and
You know,
we
if
would
you want to
very-
switch seats.
We could very quickly.
We could do that, but
I'd send in the National Guard. It would be over. There'd be no problem.
Okay,
but they
good.
don't want to accept the National Guard.
You have repeatedly criticized the vice president for not specifically calling out Antifa and other left-wing extremist groups. But are you willing tonight to condemn white supremacists and militia groups and to say that they need to stand down and not add to the violence in a number of these cities, as we saw in Kenosha and as we've seen in Portland?
Sure,
Are you
I'm willing
prepared to
do
specifically
that, but
do it?
Well, go ahead, sir.
I would say almost everything I see is from the left wing, not from the right wing.
So what are you saying?
I'm willing to do anything. I want to see peace.
Then do it, sir.
Say it. Do it. Say it.
Do you want to call him? What do you want to call him? Give me a name. Give me a
White
name. Go ahead.
supremacists and
Who would
right
you like me to condemn?
White supremacists and right
Proud
militia.
Boys, stand back and stand by. But I'll tell you what. Somebody's got to do something about Antifa and the left, because this is not a right-wing problem. This is a left-wing.
FBI director
This
said
is a
the threat-
left-wing problem.
White
Are you willing tonight to condemn white supremacists and militia groups and to say that they need to stand down and not add to the violence in a number of these cities, as we saw in Kenosha and as we've seen in Portland.
Sure,
Are you
I'm willing
prepared to
do that,
specifically
but
do it?
Well, go ahead, sir.
I would say almost everything I see is from the left wing, not from the right wing.
So what are you saying?
I'm willing to do anything. I want to see peace.
Then do it, sir.
Say it. Do it.
I'm willing to do anything. I want to see peace.
Then do it, sir.
Say it. Do it. Say it.
Do you want to call him? What do you want to call him? Give me a name. Give me a
White
name.
supremacists and
who would
white
you like me to condemn?
White supremacists and right
Proud
militia.
Boys, stand back and stand by.
Are you willing tonight to condemn white supremacists and militia groups and to say that they need to stand down and not add to the violence in a number of these cities?
Proud Boys, stand back and stand by. Proud Boys, stand back and stand by.
That they need to stand down.
Proud Boys, stand back and stand by.
That they need to stand down.
Proud Boys, stand back and stand by.
Are you willing tonight to condemn white supremacists and militia groups and to say that they need to stand down and not add to the violence in a number of these cities?
I'm willing to do anything. I want to see peace.
Then do it, sir.
Say it. Do it. Say it.
Do you want to call him? What do you want to call him? Give me a name. Give me a
White
name.
supremacists and
Who would
right
you like me to condemn?
White supremacists and right
Proud
militia.
Boys, stand back and stand by.
Supremacist. Antifa's an idea, not an organization.
Oh, you gotta be
not
kidding.
militia. That's what
Oh, really?
his
It's an idea.
FBI director
Gentlemen,
said.
Well, then you know what? He's wrong.
We're done, sir. We're moving on to the next. We're
Everybody
moving.
gives you
When a bat
advice
hits
in
you
your
over the head, that's
administration.
not an idea.
Everybody in
Antifa
your
is
administration
bad.
tells you the truth has a bad idea.
Can I tell you what?
You have no ideas.
Antifa is a dangerous
All right,
radical
gentlemen,
group.
we're now moving.
Proud Boys, founded in 2016 by Canadian-British right-wing activist Gavin McInnes, the Proud Boys is a far-right anti-immigrant, all-male group with a history of street violence against its left-wing opponents. The group's name is a reference to a song from the musical version of the Disney film Aladdin. Members often wear black and yellow Fred Perry polo shirts along with red Make America Great Again hats. A Proud Boy must declare that he is a Western chauvinist who refuses to apologize for creating the modern world. Their platform, such as it is, includes Trumpian ideas glorify the entrepreneur, close the border, libertarianism, give everyone a gun, and welfare, and traditional gender roles venerate the housewife. They're not exclusively white, yet it became notorious for violent political confrontations. The Proud Boys and affiliated groups have faced off against Antifa in a number of violent street rallies in the last 2 years, most notably in Oregon, Washington, and New York. 2 members were jailed last year for beating up Antifa activists in New York. Facebook, Instagram, Twitter, and YouTube have all banned the group from their platforms. And members and official chapters have been largely shunted towards less popular networks. Enrique Tarrio, the group's current chairman, reacted to the debate on the alternative discussion network Parler, standing by Sir. I will stand down, sir. McInnes publicly disassociated himself from the group in 2018, saying that he was taking the advice of his legal team. But in a video reacting to Tuesday's debate, he said, albeit not seeming entirely serious, I control the Proud Boys, Donald. Do not stand down, do not stand back. On the chat app Telegram, Proud Boys shared the debate clip along with posts taunting Antifa and incorporating the phrase stand back. Stand by into the group's logo. Meanwhile, critics of the president loudly condemned him. Donald Trump is a white supremacist. People have been warning about this for a long time. They were ridiculed, called hyperbolic and radical. Not BC they were wrong, but BC others couldn't accept that our country elected a supremacist as president. This is fascism at our door. Chris Wallace, are you willing tonight to condemn white supremacists and militia groups and to say that they need to stand down? Trump, Proud Boys, stand back and stand by. But I'll tell you what, somebody's got to do something about Antifa and the left. Antifa, short for anti-fascist, is a loose affiliation of mostly far-left activists. They include anarchists, but also communists and a few social democrats.
What sets them apart is their willingness to use violence in self-defense, they say. The movement, which at one point almost entirely disappeared in the U.S., saw a surge of interest after the election of Donald Trump. They routinely clash with the far right. The group has been prominent during Black Lives Matter protests in many major cities and have been particularly associated with unrest in Portland, Oregon. In late August, a self-described anti-fascist, 48-year-old Michael Reinoehl shot and killed a supporter of Patriot Prayer, a Portland area group that often marches with the Proud Boys. Reinoehl was shot dead by police the following week. Both groups are relatively small and can count on, at the most, a few thousand active supporters. But their propensity for violence, particularly when they confront each other on American streets, has made them a much bigger topic of conversation than those numbers suggest.
On to the Trump and
you ought to be
Biden
careful
records.
with them. They'll overthrow you.
When
in
a
2
president,
seconds.
I'm going to ask a question. When the president seeks a second term, it is generally a referendum on his record. But Vice President Biden, you like to quote one of your dad's sayings, which is, don't compare me to the almighty, compare me to the alternative. And in this case, sir, you are the alternative. Looking at both of your records, I'm going to ask each of you, why should voters elect you president over your opponent? In this segment, President Trump, you go first, 2 minutes.
Because there has never been an administration or president who has done more than I've done in a period of 3.5 years. And that's despite the impeachment hoax. And you saw what happened today with Hillary Clinton, where it was a whole big con job. But despite going through all of these things, where I had to fight both flanks and behind me and above, there has never been an administration that's done what I've done. The greatest, before COVID came in, the greatest economy in history, lowest unemployment numbers. Everything was good. Everything was going. And by the way, there was unity going to happen. People were calling me for the first time in years. They were calling and they were saying, it's time maybe. And then what happened? We got hit, but now we're building it back up again. A rebuilding of the military, including Space Force and all of the other things. A fixing of the VA, which was a mess under him. 308,000 people died because they didn't have proper health care. It was a mess. And we now got a 91% approval rating at the VA, our vets. We take care of our vets. But we've rebuilt our military. The job that we've done, and I'll tell you something, some people say maybe the most important. By the end of the first term, I'll have approximately 300 federal judges and Court of Appeals judges, 300, and hopefully 3 great Supreme Court justices. That is a record, the likes of which very few people, and you know one of the reasons I'll have so many judges? Because President Obama and him left me 128 judges to fill. When you leave office, you don't leave any judges. That's like, you just don't do that. They left 128 openings, and if I were a member of his party, because they have a little different philosophy, I'd say if you left us 128 openings, you can't be a good president, you can't be a good vice president. But I want to thank you because it gives us almost, it'll probably be above that number by the end of this term. 300 judges, it's a record.
Looking at both your records, why should voters elect you president as opposed to President Trump? You have 2 minutes uninterrupted.
Under this president, we become weaker, sicker, poorer, more divided, and more violent. When I was vice president, we inherited a recession. I was asked to fix it. I did. We left him a booming economy, and he caused a recession. With regard to being weaker, the fact is that I've gone head-to-head with Putin and made it clear to him we're not going to take any of his stuff. He's Putin's puppy. He still refuses to even say anything to Putin about the bounty on the heads of American soldiers.
Your son got $3.5 million.
And by the way, my son...
Wait a minute. Mr. President, your campaign agreed to both sides would get 2-minute answers uninterrupted. Well, your side agreed to it, and why don't you observe what your campaign agreed to as a ground rule, okay, sir?
He never keeps his word.
Can you add back no, I'm not asking. That was a rhetorical question.
Can you
Go
add
ahead,
back
sir.
30 seconds?
Yeah,
Because-
yes,
okay.
you may have.
All right.
Go ahead.
So, thirdly, we're poor. The billionaires have gotten much more wealthy by a tune of over $300 to $400 billion more just since COVID. You in the home, you got less. You're in more trouble than you were before. In terms of being more violent, When we were in office, there were 15% less violence in America than there is today. He's president of the United States. It's on his watch. And with regard to more divided, the nation can't stay divided. We can't be this way. And speaking of my son, the way you talk about the military, the way you talk about them being losers and being and just being suckers. My son was in Iraq. He spent a year there. He got the Bronze Star. He got the Conspicuous Service Medal. He was not a loser. He was a patriot, and the people left behind there were heroes.
Really?
And I resent.
Are you talking
like
about
hell.
Hunter? Are you talking about Hunter?
I'm talking about my son, Beau Biden. You're talking about.
I don't know Beau. I know Hunter.
Yeah,
Hunter
you know
got
Beau.
thrown. Hunter got thrown out of the military. He was thrown out, dishonorably discharged.
That's not true. He
for
wasn't dishonorably.
cocaine use. And he didn't have a job until you became vice president. And once you
None
became
of that
vice
is
president,
true.
he made a fortune in Ukraine, in China, in Moscow,
That is simply
and various
not
other places.
true.
He
My
made
son,
a fortune.
my son,
and he didn't have a job.
My son, like a lot of people.
I don't know. I don't know Beau. I know Hunter.
Yeah,
Hunter
you know
got
Beau.
thrown. Hunter got thrown out of the military. He was thrown out, dishonorably discharged.
That's not true. He
for
wasn't dishonorably.
cocaine use. And he didn't have a job until you became vice president. And once you
None of
became
that
vice
is
president,
true.
he made a fortune in Ukraine, in China, in Moscow,
That is simply
and various
not
other places.
true.
He
My
made a
son,
fortune.
my son,
and he didn't have a job.
My son, like a lot of people.
Biden's son Hunter discharged from Navy Reserve after failing cocaine test by Colleen McCain Nelson and Julian E. Barnes updated October 16, 2014, 7:35 p.m. Eastern Time, Washington. Vice President Joe Biden's son Hunter was discharged from the Navy Reserve this year after testing positive for cocaine, according to people familiar with the matter. Hunter Biden, a lawyer by training who is now a managing partner at an investment company, had been commissioned as an ensign in the Navy Reserve, a part-time position. But after failing a drug test last year, his brief military career ended. Mr. Biden, 44 years old, decided to pursue military service relatively late, beginning the direct commission process to become a public affairs officer in the Navy Reserve in 2012. Because of his age 43 when he was to be commissioned, he needed a waiver to join the Navy. He received a second Navy waiver because of a drug-related incident when he was a young man, according to people familiar with the matter. Military officials say such drug waivers aren't uncommon. Mr. Biden was commissioned as an ensign on May 7, 2013, and assigned to Navy Public Affairs Support Element East in Norfolk, Virginia, a reserve unit, according to the Navy. In June 2013, after reporting to his unit in Norfolk, he was given a drug test which turned up positive for cocaine, according to people familiar with the situation. Mr. Biden was discharged in February. The Navy said, Mr. Biden said in a statement that it was the honor of my life to serve in the U.S. Navy, and I deeply regret and I'm embarrassed that my actions led to my administrative discharge. I respect the Navy's decision. With the love and support of my family, I'm moving forward. The Vice President's office declined to comment. The Navy said Mr. Biden met all of the criteria for a direct commission, but declined to provide any details of why he was discharged. Like other junior officers, the details of ends. Biden's discharge are not releasable due to the Privacy Act, CMDR. Ryan Perry, a Navy spokesman, said. Science says addiction is a chronic disease, not a moral failing. Jillian Hardy, Ph.D. May 19, 2017, 7 a.m. Understanding the brain's role in addiction can help break the stigma surrounding the illness and encourage individuals to seek help. In a November 2016 report, former Surgeon General Vivek Murthy, MD, publicly confirmed what researchers have known for years: addiction is a chronic illness accompanied by significant changes in the brain. Addiction does not occur because of moral weakness, a lack of willpower, or an unwillingness to stop. This finding stems from decades of work investigating the effects of substance use on the brain. The first time individuals drink or take drugs, they do so voluntarily, and they believe they can control their use. With time, more and more alcohol or drugs are needed to achieve the same level of pleasure and satisfaction as when they first started. Seeking out and taking the substance becomes a near constant activity, causing significant problems for them and their family and friends. At the same time, progressive changes in the brain drive the compulsive, uncontrollable drug use known as addiction. When this happens, individuals can no longer voluntarily choose to not use drugs or alcohol, even if it means losing everything they once valued. Addiction does not occur because of moral weakness, a lack of willpower, or an unwillingness to stop. Jillian Hardy, Ph.D. The Brain on Addiction research has identified a number of areas in the brain key to the development and persistence of addiction. In particular, pathways containing dopamine are where many drugs exert their effects. Dopamine is a small chemical in the brain important for carrying signals from one brain cell to the next. Similar to how a train carries cargo between stations, pathways where dopamine is present are involved in many different functions, one of which is reward-motivated behavior. In the healthy brain, dopamine is released in response to natural rewards such as food or exercise as a way of saying, that was good. But drugs hijack dopamine pathways, teaching the brain that drugs are good, too. For example, some drugs have a structure similar to other chemical messengers in the brain, allowing them to bind to brain cells and release dopamine. Therefore, taking a drug produces a euphoric feeling, which in turn strongly reinforces drug-using behavior. Drugs release 2 to 10 times the amount of dopamine that natural rewards release. How much is released depends on the type of drug. Amphetamines, for example, release more dopamine than cocaine. As a result, the increased and sometimes constant influx of dopamine means feelings of reward, motivation, or pleasure are also increased. But if substance use continues, the brain produces less dopamine and/or reduces the number of brain structures that receive dopamine. Thus, dopamine's impact on the reward network diminishes, along with the individual's ability to experience pleasure. This explains why individuals who chronically abuse drugs or alcohol begin to appear lethargic, unmotivated, and depressed, and report a lack of pleasure in things that were once pleasurable. To counter this, they increase their substance use in an attempt to feel the same pleasure they used to. This only exacerbates the problem, creating a vicious cycle of needing to take the drug in order to regain dopamine levels, then later needing to increase the dose, and so on. An effect known as tolerance. While short-term use may only produce small transient effects in the brain, prolonged substance use changes the brain in fundamental ways that reinforce continued use, such as the strengthening of memory circuits associated with drug taking, cues that are social, such as being around substance-using friends, geographic former favorite bars, and physical, experiencing stress and nature become strongly associated with the drug. These have a powerful impact on the brain, no matter if that person has been abstinent for 15 days or 15 years, and can trigger a relapse. Brain changes from chronic drug or alcohol use can persist years after a person quits. This is why individuals risk relapse even after long periods of abstinence, and despite a relapse's potentially devastating effects. More importantly, this is why treatment depends on the type of drug and the individual characteristics of the patient. Understanding the brain's role in addiction can help reduce negative perceptions and attitudes of those struggling with substance use disorders. Because addiction is typically a chronic disorder characterized by intermittent relapses, a short-term, one-time treatment is generally not sufficient. However, research shows that addiction can be managed successfully. Individuals who enter and remain in treatment can manage their addiction and improve their quality of life.
One of my earliest memories is of trying to wake up one of my relatives and not being able to. And I was just a little kid, so I didn't really understand why. But as I got older, I realized we had drug addiction in my family, including later cocaine addiction. And I've been thinking about it a lot lately, partly because it's now exactly 100 years since drugs were first banned in the United States and Britain, and we then imposed that on the rest of the world. It's a century since we made this really fateful decision to take addicts and punish them and make them suffer because we believe that would deter them, it would give them an incentive to stop. And a few years ago, I was looking at some of the addicts in my life who I love and trying to figure out if there was some way to help them. And I realized there were loads of incredibly basic questions I just didn't know the answer to. Like, what really causes addiction? Why do we carry on with this approach that doesn't seem to be working? And is there a better way out there that we could try instead? So I read loads of stuff about it, and I couldn't really find the answers I was looking for. So I thought, okay, I'll go and sit with different people around the world who lived this and studied this and talk to them and see if I can learn from them. And I didn't realize I would end up going over 30,000 miles at the start, but I ended up going and meeting loads of different people, from a transgender crack dealer in Brownsville, Brooklyn, to a scientist who spends a lot of time feeding hallucinogens to mongooses to see if they like them. It turns out they do, but only in very specific circumstances. To the only country that's ever decriminalized all drugs, from cannabis to crack, Portugal. And the thing I realized that really blew my mind is almost everything we think we know about addiction is wrong. And if we start to absorb the new evidence about addiction, I think we're going to have to change a lot more than our drug policies. But let's start with what we think we know, what I thought I know, right? Think about this middle row here, right? Imagine all of you for 20 days now went off and used heroin 3 times a day. Some of you feel a bit more enthusiastic than others at this prospect. Don't worry, it's just a thought experiment. Imagine you did that, right? What would happen? Now, we have a story about what would happen that we've been told for a century. We think because there are chemical hooks in heroin, as you took it for a while, your body would become dependent on those hooks, you'd start to physically need them, and at the end of those 20 days, you'd all be heroin addicts, right? That's what I thought. First thing that alerted me to the fact something not right with this story. So it's explained to me, if I step out of this TED Talk today and I get hit by a car and I break my hip, I'll be taken to hospital and I'll be given loads of diamorphine. Diamorphine is heroin. It's actually much better heroin than you're ever going to buy on the street, because the stuff you buy from a drug dealer is contaminated. Actually, very little of it is heroin, whereas the stuff you get from the doctor is medically pure. And you'll be given it for quite a long period of time. There are loads of people in this room who may not realize that you've taken quite a lot of heroin, right? And anyone watching this anywhere in the world, this is happening. And if what we believe about addiction is right, those people are exposed to all those chemical hooks. What should happen? They should become addicts. This has been studied really carefully. It doesn't happen. You will have noticed if your grandmother had a hip replacement, she didn't come out as a junkie. And when I learned this, it just seemed so weird to me. So contrary to everything I'd been told, everything I thought I knew, I just thought it couldn't be right. Until I went and met a man called Bruce Alexander, who's a professor of psychology in Vancouver, who carried out an incredible experiment that I think really helps us to understand this issue. Professor Alexander explained to me The idea of addiction we've all got in our head, that story, comes partly from a series of experiments that were done earlier in the 20th century. They're really simple experiments. You can do them tonight when you go home if you feel a little bit sadistic. You get a rat and you put it in a cage and give it 2 water bottles. One is just water and the other is water laced with either heroin or cocaine. If you do that, the rat will almost always prefer the drugged water and almost always kill itself quite quickly. So there you go, right? That's how we think it works. In the 70s, Professor Alexander comes along and he looks at this experiment and he noticed something. He said, we're putting the rat in an empty cage. It's got nothing to do except use these drugs. Let's try something a bit different. So Professor Alexander built a cage that he called Rat Park, which is basically heaven for rats, right? They've got loads of cheese, they've got loads of coloured balls, they've got loads of tunnels. Crucially, they've got loads of friends, they can have loads of sex, and they've got both the water bottles, the normal water and the drugged water. But here's the fascinating thing. In Rat Park, they don't like the drugged water. They almost never use it. None of them ever use it compulsively. None of them ever overdose. You go from almost 100% overdose when they're isolated to 0% overdose when they have happy and connected lives. Now, when I first saw this, Professor Alexander thought, maybe this is just a thing about rats. They're quite different to us, maybe not as different as we'd like, but, but fortunately, there was a human experiment with the exact same principle happening at the exact same time. It was called the Vietnam War. In Vietnam, 20% of all American troops were using loads of heroin. And if you look at the news reports from the time, they were really worried because they thought, my God, we're going to have hundreds of thousands of junkies on the streets of the United States when the war ends. It made total sense. Now, those soldiers who were using loads of heroin were followed home. The Archives of General Psychiatry did a really detailed study on what happened to them. It turns out they didn't go to rehab. They didn't go into withdrawal. 95% of them just stopped. Now, if you believe the story about chemical hooks, that makes absolutely no sense. Professor Alexander began to think there might be a different story about addiction. He said, what if addiction isn't about your chemical hooks? What if addiction is about your cage? What if addiction is an adaptation to your environment? Looking at this, there was another professor called Peter Cohen in the Netherlands who said, maybe we shouldn't even call it addiction. Maybe we should call it bonding. Human beings have a natural and innate need to bond. And when we're happy and healthy, we'll bond and connect with each other. But if you can't do that because you're traumatized or isolated or beaten down by life, you will bond with something that will give you some sense of relief. Now, that might be gambling, that might be pornography, that might be cocaine, that might be cannabis. But you will bond and connect with something because that's our nature. That's what we want as human beings. And I think, at first I found this quite a difficult thing to get my head around, but one way that helped me to think about it is, and I can see, I've got over by my seat there a bottle of water, right? I'm looking at lots of you, and lots of you have bottles of water with you, right? Forget drugs, forget the drug war. Totally legally, all of those bottles of water could be bottles of vodka, right? We could all be getting drunk, I might after this. But we're not, right? Now, because you've been able to afford the approximately £1 gazillion that it costs to get into a TED Talk, I'm guessing you guys could afford to be drinking vodka for the next 6 months. You wouldn't end up homeless. You're not going to do that. And the reason you're not going to do that is not because anyone's stopping you. It's because you've got bonds and connections that you want to be present for. You've got work you love. You've got people you love. You've got healthy relationships. And a core part of addiction, I came to think, and I believe the evidence suggests, is about not being able to bear to be present in your life. Now, this has really significant implications. The most obvious implications are for the war on drugs, right? In Arizona, I went out with a group of women who were made to wear T-shirts saying I was a drug addict and go out on chain gangs and dig graves while members of the public would jeer at them. And when those women get out of prison, they're going to have criminal records that mean they'll never work in the legal economy again. Now, that's a very extreme example, obviously, in the case of the chain gang, but actually almost everywhere in the world we treat addicts to some degree like that. We punish them, we shame them, we give them criminal records, we put barriers between them reconnecting. And there was a doctor in Canada, Dr. Gabor Mate, an amazing man, who said to me, if you wanted to design a system that would make addiction worse, you would design that system. Now, there's a place that decided to do the exact opposite, and I went there to see how it worked. In the year 2000, Portugal had one of the worst drug problems in Europe. 1% of the population was addicted to heroin, which is kind of mind-blowing. And every year, they tried the American way more and more. They punished people and stigmatized them and shamed them more. And every year the problem got worse. And one day the Prime Minister and the leaders of the opposition got together and basically said, look, we can't go on with a country where we're having ever more people becoming heroin addicts. Let's set up a panel of scientists and doctors to figure out what would genuinely solve the problem. And they set up a panel led by an amazing man called Dr. Farrell Gulao to look at all this new evidence. And they came back and they said, decriminalize all drugs, from cannabis to crack. But, and this is the crucial next step, take all the money we used to spend on cutting addicts off, on disconnecting them, and spend it instead on reconnecting them with the society. And that's not really what we think of. What they did wasn't really what we think of as drug treatment in the United States and Britain. They do residential rehab, they do psychological therapy that does have some value. But the biggest thing they did was the complete opposite of what we do. A massive program of job creation for addicts and micro loans for addicts to set up small businesses. So say you used to be a mechanic. When you're ready, they go to a garage and they'll say, if you employ this guy for a year, we'll pay half his wages. The goal was to make sure that every addict in Portugal had something to get out of bed for in the morning. And when I went and met the addicts in Portugal, it was fascinating. What they said is, as they rediscovered purpose, they rediscovered bonds and relationships with the wider society. It'll be 15 years this year since that experiment began, and the results are in. Injecting drug use is down in Portugal, according to the British Journal of Criminology, by 50%, 50%. Overdose is massively down. HIV is massively down among addicts. Addiction in every study is significantly down. One of the ways you know it's worked so well is that almost nobody in Portugal wants to go back to the old system. Now, that's the kind of political implications. I actually think there's a layer of implications to all this research below that. You know, we live in a culture where people feel really increasingly vulnerable to all sorts of addictions, whether it's to their smartphones or to shopping or to eating. You know, before these talks began, you guys know this, that we were told we weren't allowed to have our smartphones on. And I have to say, a lot of you looks an awful lot like addicts who were being told their dealer was going to be unavailable for the next couple of hours. And yeah, a lot of us feel like that. And it might sound weird to say, oh, you know, I've been talking about how disconnection is a major driver of addiction. But weird to say it's growing because you think, well, we're the most connected society there's ever been, surely. But I increasingly began to think that the connections we have, we think we have, are like a kind of parody of human connection. If you have a crisis in your life, you'll notice something. It won't be your Twitter followers who come to sit with you. It won't be your Facebook friends who help you turn it round. It'll be your flesh and blood friends who you have deep and nuanced and textured face-to-face relationships with. And I think there's a study I read about from Bill McKibben, the environmental writer, I think tells us a lot about this. It looked at the number of close friends the average American believes they can call on in a crisis. That number has been declining steadily since the 1950s. The amount of floor space an individual has in their home has been steadily increasing. And I think that's like a metaphor for the choice we've made as a culture, right? We've traded floor space for friends. We've traded stuff for connections. And the result is that we are one of the loneliest societies there has ever been. And yet, Bruce Alexander, the guy who did the Rat Park experiment, says, we talk all the time in addiction about individual recovery. And it's right to talk about that. But we need to talk much more about social recovery. Something's gone wrong with us, not just as individuals, but as a group. And we've created a society where, for a lot of us, life looks a whole lot more like that isolated cage and a whole lot less like Rat Park. If I'm honest, this isn't why I went into it, right? I didn't go in to discover the political stuff, the social stuff. I wanted to know how to help the people I love. And when I came back from this long journey and I'd learned all this, I looked at the addicts in my life, and if you're really candid, it's hard loving an addict, and there's going to be lots of people who know in this room you are angry a lot of the time. And I think one of the reasons why this debate is so charged is because it runs through the heart of each of us, right? Everyone has a bit of them that looks at an addict and thinks, I wish someone would just stop you. And the kind of script we're told for how to deal with the addicts in our lives is typified by, I think, by the reality show Intervention. If you guys haven't seen it, I think everything in our lives is typified by reality TV, but that's another TED Talk. If you're not in the show Intervention, it's a pretty simple premise. You get an addict, all the people in their life gather them together and say, if you don't shape up, confront them with what they're doing, and they say, if you don't shape up, we're going to cut you off, right? So what they do is they take the connection to the addict and they threaten it. They make it contingent on the addict behaving the way they want. And I began to see why that approach doesn't work. And I began to think that almost that's like the importing of the logic of the drug war into our private lives. So I was thinking, well, how can I be Portuguese, right? And what I try to do now, and I can't tell you I do it consistently, and I can't tell you it's easy, is to say to the addicts in my life that I want to deepen the connection with them, to say to them, I love you, whether you're using or you're not. I love you, whatever state you're in. And if you need me, I'll come and sit with you because I love you and I don't want you to be alone or to feel alone. And I think the core of that message, you're not alone, we love you, has to be at every level of how we respond to addicts, socially, politically, and individually. For 100 years now, we've been singing war songs about addicts. I think all along we should have been singing love songs to them, because the opposite of addiction is not sobriety. The opposite of addiction is connection. Thank you.
For 12 years, I worked in Vancouver's downtown east side, which is North America, certainly Canada's most concentrated area of drug use. So my patients were heavily addicted, suffering from HIV, mental illness, and many other problems. And those were my clients for 12 years. Before we ask how we handle something, we have to understand, what are we handling? If you took your car to a mechanic, his first question would be, how do I fix this? His first question would be, how do I diagnose the problem? How do I understand the problem? Then he can talk about what's the best way to treat it. It's the same with addiction. And unfortunately, most of the medical profession and the legal system does not understand addiction. Therefore, our treatment and legal solutions tend not to be helpful. In fact, they often tend to be harmful. The essence of addiction is trauma. The people that are addicted are people that were traumatized in childhood. And the reason, for example, in this province, in Saskatchewan, as in other provinces, there's a vast disproportion in the number of Native people who are addicted and who are jailed compared to the rest of the population, is because they're the most traumatized segment of our population. The historical trauma, which I don't have to go and repeat, I don't think, but the loss of lands and the destruction of their culture, and then the abduction of their children for 100 years and their abuse in the residential schools. It's created a multi-generational template from which then trauma is passed on from one cohort to another. And so simply to focus on the behavior of addiction is missing the point. Addiction, any addiction, whether it's to sex or gambling or internet or drugs, shopping or eating, is simply an attempt on the part of a person to feel better temporarily. Why do they need to feel better? Because they don't feel good. Why don't they feel good? Because they've suffered. And so why are we punishing people for having suffered? And the other point I need to make is that even if you look at the physiology of the brain, that itself is shaped by early life experience. So people who are traumatized early in life have brains that don't function as well. So now we're having people that somewhat impaired brain function in some very important circuits. It's none of their fault. Then they act from that impaired brain circuits, then we punish them for it, or we judge them for it, or we just try and concentrate on the symptom. Addiction is only a symptom. It's not the fundamental problem. The fundamental problem is trauma.
Joe Biden has had a surprisingly tragic life. Just a few years ago, he lost his oldest son, Beau, to cancer, while his younger son, Hunter, has spent years struggling to free himself from dependence on drugs and alcohol. Perhaps the greatest sorrow in Joe Biden's life, however, occurred early on in his senatorial career when he received the kind of phone call every spouse and parent dreads.
But the call said, my wife was dead, my daughter was dead, and I wasn't sure how my sons were going to make it.
As Biden told Marie Claire on December 18, 1972, my wife and 3 children were Christmas shopping. A tractor-trailer broadsided them and killed my wife and killed my daughter. Suddenly, the young senator-elect from Delaware found himself a single dad with his 2 surviving kids in the hospital with serious injuries, and he was actually sworn into office at their bedsides. Hunter, in presenting Beau's eulogy in 2015, noted that being in the hospital was his very first memory. He said, I was almost 3 years old. I remember my brother, who was 1 year and 1 day older than me, holding my hand, staring into my eyes, saying, "I love you, I love you, I love you," over and over and over again. Once the kids were out of the hospital, Biden resumed his political career but rode the train back to their home in Wilmington every night from his D.C. office, a habit that earned him the nickname Amtrak Joe. The first Mrs. Biden, Nelia Hunter, was born in 1942 in Skaneateles, New York. She later studied at Syracuse University and during her junior year took a spring break trip to Nassau, where she met a University of Delaware junior named Joe. Evidently, they hit it off, since a few years later, Joe decided to attend law school at Syracuse, and the two married in August of 1966. After the couple wed, they moved to Wilmington, Delaware, where new lawyer Joe got his first start in politics by serving on the Newcastle County Council. Soon Joe would take things a step further, challenging Delaware's Republican incumbent Senator J. Caleb Boggs for his seat. Nelia was said to be the brains behind the campaign, somehow managing to engineer his come-from-behind win while simultaneously mothering 3 small children. In her autobiography, Where the Light Enters, Joe's current wife, Jill Biden, describes how she had the pleasure of meeting Nelia just a month before her untimely demise. She wrote about her easy, natural beauty and her warm smile. She also wrote about how unfair the situation was. To take a mother from her children, to take a daughter from her father, Joe Biden had had everything, and in a horrible second, it was gone. According to The Independent, shortly after Biden's victory in the November 1972 election, Nelia asked her husband, "What's going to happen, Joey? Things are too good." Sadly, she was right. Just 1 week before Christmas came the car crash as a tractor-trailer carrying corn slammed into the side of the Biden family's Chevy station wagon. In that terrible moment, as Biden later described, "My whole world was altered forever." He soldiered through, however, not only holding up through a memorial service that drew a crowd of 1,200, but staying strong to help his injured sons. As Biden wrote in 2017's Promise Me Dad, "The pain had seemed unbearable in the beginning, and it took me a long time to heal, but I did survive the punishing ordeal. I made it through with a lot of support and reconstructed my life and my family." Biden has mentioned this profoundly sad event in many speeches he's given over the years, including a 2012 address to U.S. military service members and how hard it can be to move on after such an unspeakable tragedy. He said, "Keep thinking what your husband or wife would want you to do. Keep thinking what it is, and keep remembering those kids of yours, or him or her, the rest of their life. Blood of my blood, bone of my bone. Because, folks, it can and will get better."
I don't know, Bo. I know Hunter. Hunter got thrown out of the military. He was thrown out, dishonorably discharged.
That's not true. He
For
wasn't dishonorably.
cocaine use, and he didn't have a job until you became vice president. And once you became vice president, he made a fortune in Ukraine, in China, in Moscow,
That is simply
and various
not
other places.
true.
He
My
made a
son,
fortune.
my son,
And he didn't have a job.
my son, like a lot of people.
I don't know, Bo. I know Hunter.
Yeah, you
Hunter
know,
got
Bo.
thrown. Hunter got thrown out of the military. He was thrown out, dishonorably discharged.
That's not true. It
For
wasn't dishonorably.
cocaine use, and he didn't have a job until you became vice president. And once you
None of
became
that
vice
is
president, he made a fortune in Ukraine, in China, in Moscow,
That is simply
and various
not
other places.
true.
He
My
made a
son,
fortune.
my son,
and he didn't have a job.
my son, like a lot of people.
I don't know, Bo. I know Hunter.
Yeah, you
Hunter
know,
got
Bo.
thrown. Hunter got thrown out of the military. He was thrown out, dishonorably discharged.
That's not true. It
For
wasn't dishonorably.
cocaine use, and he didn't have a job until you became vice president. And once you
None of
became
that
vice
is
president,
true.
he made a fortune in Ukraine, in China, in Moscow,
That is simply
and various
not
other places.
true.
He
My
made a
son,
fortune.
my son,
and he didn't have a job.
my son, like a lot of people.
I don't know, Bo. I know Hunter.
Yeah, you
Hunter
know,
got
Bo.
thrown. Hunter got thrown out of the military. He was thrown out, dishonorably discharged.
That's not true. It
For
wasn't dishonorably.
cocaine use, and he didn't have a job until you became vice president. And once you
None of
became
that
vice
is
president,
true.
he made a fortune in Ukraine, in China, in Moscow,
That is simply
and various
not
other places.
true.
He
My
made a
son,
fortune.
my son,
and he didn't have a job.
my son, like a lot of people.
I don't know, Bo. I know Hunter.
Yeah, you
Hunter
know,
got
Bo.
thrown. Hunter got thrown out of the military. He was thrown out, dishonorably discharged.
That's not true. It
For
wasn't dishonorably.
cocaine use, and he didn't have a job until you became vice president. And once you
None of
became
that
vice
is
president, he made a fortune in Ukraine, in China, in Moscow,
That is simply
and various
not
other places.
true.
He
My
made a
son,
fortune.
my son,
and he didn't have a job.
my son, like a lot of people.
I don't know, Bo. I know Hunter.
Yeah, you
Hunter
know,
got
Bo.
thrown. Hunter got thrown out of the military. He was thrown out, dishonorably discharged.
That's not true. It
For
wasn't dishonorably.
cocaine use, and he didn't have a job until you became vice president. And once you
None of
became
that
vice
is
president, he made a fortune in Ukraine, in China, in Moscow,
That is simply
and various
not
other places.
true.
He
My
made a
son,
fortune.
my son,
and he didn't have a job.
my son, like a lot of people.
I don't know, Bo. I know Hunter.
Yeah, you
Hunter
know,
got
Bo.
thrown. Hunter got thrown out of the military. He was thrown out, dishonorably discharged.
That's not true. It
For
wasn't dishonorably.
cocaine use, and he didn't have a job until you became vice president. And once you
None of
became
that
vice
is
president, he made a fortune in Ukraine, in China, in Moscow,
That is simply
and various
not
other places.
true.
He
My
made a
son,
fortune.
my son,
and he didn't have a job.
my son, like a lot of people. Like a lot of people we know at home had a drug problem. He's overtaken it. He's fixed it. He's worked on it, and I'm proud of him.
But why
I'm
was he
proud of
given
my
tens
son.
of millions
All
of
right, but he
dollars?
wasn't given
All right,
tens of
he
millions
was
of dollars.
given
That
tens
is
of
totally,
millions of
that
dollars.
is totally discredited.
You've already been through.
Totally discredited.
We've already been through this. I think the American people would rather hear about more substantial
So do I.
subjects. Well, you know, as the moderator, sir, I'm going to make a
I know, but when
judgment call
somebody
here.
gets $3.5 million
Okay, right.
from the
Let's
mayor
talk
of
about-
Moscow,
let's talk
That is
about-
I
not
think it's a
true.
Gentlemen,
That
terrible thing.
report is totally
Why did he get
discredited.
it?
I
Mitt
think-
Romney on that committee said it wasn't worth taxpayers' money, that report. It was written for political reasons.
You know, I'd like to talk about climate change.
So would I.
Okay. The forest fires in the West are raging now. They have burned millions of acres. They have displaced hundreds of thousands of people. When state officials there blame the fires on climate change, Mr. President, you said, I don't think the science knows. Over your 4 years, you have pulled the U.S. out of the Paris Climate Accord. You have rolled back a number of Obama environmental records. What do you believe about the science of climate change? And what will you do in the next 4 years to confront it?
I want crystal clean water and air. I want beautiful, clean air. We have now the lowest carbon. If you look at our numbers right now, we are doing phenomenally. But I haven't destroyed our businesses. Our businesses aren't put out of commission. If you look at the Paris Accord, it was a disaster from our standpoint. And people are actually very happy about what's going on because our businesses are doing well. As far as the fires are concerned, you need forest management in addition to everything else. The forest floors are loaded up with trees, dead trees that are years old, and they're like tinder, and leaves and everything else. You drop a cigarette in there, the whole forest burns down. You've got to have forest management.
What do you
You've got to have
believe?
cuts.
What do you believe about the science of climate change, sir?
I believe that we have to do everything we can to have immaculate air, immaculate water, and do whatever else we can that's good. You know, we're planting 1 billion trees, the Billion Tree Project, and it's very
Do you
exciting
believe
for a lot of people.
that human pollution, greenhouse gas emissions contributes to the global warming of this
I think
planet?
a lot of things do, but I think to an extent, yes. I think to an extent, yes. But I also think we have to do better management of our forests. Every year, I get the call, California's burning. California's burning. If that was cleaned, if you had forest management, good forest management, you wouldn't be getting those calls. You know, in Europe, they have forest cities. They're called forest cities. They maintain their forests. They manage their forests. I was with the head of a major country. It's a forest city. He said, sir, we have trees that are far more, they ignite much easier than California. There shouldn't be that problem. I spoke with the governor about it. I'm getting along very well with the governor. But I said, you know, at some point, you can't every year have hundreds of thousands of acres of land just burned to the ground. That's burning down because of a lack of management.
But, sir, if you believe in the science of climate change, why have you rolled back the Obama Clean Power Plan, which limited carbon emissions in power plants? Why have you relaxed?
Because it was driving energy prices through the sky.
Why have you relaxed fuel economy standards that are going to create more pollution from cars
Well,
and
not
trucks?
really, because what's happening is the car is much less expensive and it's a much safer car. And you're talking about a tiny difference. And then what would happen, because of the cost of the car, you would have at least double and triple the number of cars purchased. We have the old slugs out there that are 10, 12 years old. If you did that, the car would be safer. It would be much cheaper by
But
$3,500.
in the case of California, they've simply
No, but you
ignored
would take
your
a lot of cars
roadmap.
off the market because people would be able to afford a car. Now, and by the way, we're going to see how that turns out. But a lot of people agree with me, many people. The car has gotten so expensive because they have computers all over the place for an extra little bit of gasoline. And, and I'm okay with electric cars, too. I think I'm all for electric cars. I've given big incentives for electric cars. But what they've done in California is just crazy.
Vice President Biden, I'd like you to respond to the president's climate change record, but I also want to ask you about a concern. You proposed $2 trillion in green jobs. You talk about new limits, not abolishing, but new limits on fracking, ending the use of fossil fuels to generate electricity by 2035, and zero net emission of greenhouse gases by 2050. The president says a lot of these things would tank the economy and cost millions of jobs.
He's absolutely wrong, number one. Number two, if in fact, during our administration, the Recovery Act, I was in charge, able to bring down the cost of renewable energy to cheaper than or as cheap as coal and gas and oil. Nobody's going to build another coal-fired plant in America. No one's going to build another oil-fired plant in America. They're going to move to renewable energy, number one. Number two, we're going to make sure that we are able to take the federal fleet and turn it into a fleet that's run on their electric vehicles. Making sure that we can do that, we're going to put 500,000 charging stations in all of the highways that we're going to be building in the future. We're going to build an economy that, in fact, is going to provide for the ability us to take 4 million buildings and make sure that they, in fact, are weatherized in a way that, in fact, they'll emit significantly less gas and oil because the heat will not be going out. There's so many things that we can do now to create thousands and thousands of jobs. We can get to net zero in terms of energy production by 2035. Not only not costing people jobs, creating millions of good paying jobs, not $15 an hour, but prevailing wage, by having a new infrastructure that, in fact, is green. And the first thing I will do, I will rejoin the Paris Accord. I will join the Paris Accord because with us out of it, look what's happening. It's all falling apart. And talk about someone who has no relationship with foreign policy. Brazil, the rainforests of Brazil are being torn down, are being ripped down. More carbon is absorbed in that rainforest than every bit of carbon that's emitted in the United States. Instead of doing something about that, I would be gathering up and making sure we had the countries of the world coming up with $20 billion and say, here's $20 billion. Stop tearing down the forest. And if you don't, then you're going to have significant economic consequences.
What about the argument that President Trump basically says that you have to balance environmental interests and economic interests, and he's drawn his line
Well, he hadn't drawn a line. He still, for example, makes sure that he wants to make sure that methane's not a problem. You can now emit more methane without it being a problem. Methane. This is a guy who says that you don't have to have mileage standards for automobiles that exist now. This is a guy who says that, well, the fact that it's all true. And here's the deal.
He's talking about the Green New Deal, and it's not $2 billion or $20 billion, as you said. It's $100 trillion.
I'm talking about
where they want to rip down buildings
and
and rebuild the building.
No,
it's the
that is
dumbest,
not-
most
that
ridiculous.
is not
where
the
airplanes are out of
Wait a minute,
business,
that's it.
where two-car systems are out, where they
Not
want to
true.
take out the cows too.
Not
That's
true.
not true either, right?
Not
this is
true.
this is a 100
Simply,
trillion.
look,
That's more money than
that
our
is-
country could make in
that is
100
simply
years if we're
not
going by
the case.
All right, let me
destroy our
because I
country.
actually wait a minute, sir. I actually have studied your plan, and it includes upgrading 4 million buildings, weatherizing 2 million homes over 4 years, building 1.5 million energy-efficient homes. So the question becomes: the president is saying, I think some people who support the president would say that sounds like it's going to cost a lot of money and hurt the economy.
What it's going to do is going to create thousands and millions of jobs, good-paying jobs.
But let him finish, sir.
He doesn't know how to do that.
$100 billion.
The fact is, it's going to create millions of good-paying jobs, and these tax incentives for people to weatherize, which he wants to get rid of. It's going to make the economy much safer. Look how much we're paying now to deal with the hurricanes. By the way, he has an answer for hurricanes. He said maybe we should drop a nuclear weapon on them. They may.
I never said that.
That's
at all.
he did say.
You made it up.
And here's the deal.
You make up a
we
lot of
we are going to be in a position where we can create hard, good jobs by making sure the environment is clean and we all are in better shape. We spend billions of dollars now, on floods, hurricanes, rising seas. We're in real trouble. Look what's happened just in the Midwest with these storms that come through and wipe out entire sections and counties in Iowa. That didn't happen before. They're because of global warming. We make up 15% of the world's problem. But the rest of the world, we've got to get them to come along. That's why we have to get back into the Paris Accord.
All right, gentlemen.
Wait a minute, Chris. So why didn't he do it for 47 years? You were vice president. Why didn't you get the world? China sends up real dirt into the air. Russia does. India does. They all do. We're supposed to be good. And by the way, he made a couple of statements. The Green New Deal is $100 trillion,
That is
not
not
$20
my
billion.
plan.
That's
The Green
well,
New
you want to
Deal
rebuild every
is not
building.
my plan.
You want to
All right,
rebuild
all right.
every.
If he knew anything about, if he knew
Gentlemen,
anything
He made a
about,
statement
Gentlemen.
about the military. He said I said something about the military. He and his friends made it up, and then they went with it. I never said it.
Okay.
That is
what
not
he
true.
did
Sir,
is he
you're done in
said
this segment.
he called the military
Mr. Vice President,
stupid bastards.
I
and he
did
said
not
it on
say
tape.
that.
He said
Mr.
stupid
Please,
bastards. He
not
said
sir,
it.
stop.
I would never
I
say
would
that
play
to
it.
the military.
Play it.
Go ahead. Mr.
You're on
Vice
tape.
President answered his final question.
The final question is, I can't remember which of all his rantings. was the final question.
I'm having a little trouble myself, but and about the economy and about this question of what it's going to cost.
The economy.
I mean, the Green New Deal and the idea of what your
the
environmental
Green New
changes
Deal-
will do.
The Green New Deal will pay for itself as we move forward. We're not going to build plants that, in fact, are great polluting plants.
So do you
We're going to
support
build
the Green New Deal?
Pardon me?
Do you support?
No, I don't support the Green New
Oh,
Deal.
you don't? Oh, well, that's a big statement.
I
That
support
means you
the
just
Biden.
lost the radical left.
I
Oh,
support
you
the
don't.
Biden plan that I put forward.
Okay.
The Biden plan, which is different than what he calls the radical Green New Deal.
All right, gentlemen, final segment, election integrity. As we meet tonight, millions of Americans are receiving mail-in ballots or going to vote early. How confident should we be that this will be a fair election? And what are you prepared to do over the next 5+ weeks, because it'll not only be to Election Day, but also counting some ballots, mail-in ballots after Election Day. What are you prepared to do to reassure the American people that the next president will be the legitimate winner of this election? In this final segment, Mr. Vice President, you go first.
Prepared to let people vote. They should go to iwillvote.com, decide how they're going to vote, when they're going to vote, and what means by which they're going to vote. His own Homeland Security Director, and as well as the FBI Director, says there is no evidence at all that mail-in ballots are a source of being manipulated and cheating. They said that. The fact is that there are going to be millions of people because of COVID that are going to be voting by mail-in ballots, like he does, by the way. He sits behind the Resolute desk and sends his ballot to Florida, number one. Number two, we're going to make sure that those people who want to vote in person are able to vote because enough poll watchers are there to make sure they can socially distance. The polls are open on time, and the polls stay open until the votes are counted. And this is all about trying to dissuade people from voting because he's trying to scare people into thinking that it's not going to be legitimate. Show up and vote. You will determine the outcome of this election. Vote, vote, vote. If you're able to vote early in your state, vote early. If you're able to vote in person, vote in person. Vote whatever way is the best way for you, because he cannot stop you from being able to determine the outcome of this election. And in terms of whether or not when the votes are counted, and they're all counted, that will be accepted. If I win, that will be accepted. If I lose, that'll be accepted. But by the way, if in fact he says he's not sure what he's going to accept, well, let me tell you something. It doesn't matter, because if we get the votes, it's going to be all over. He's going to go. He can't stay in power. It won't happen. It won't happen. So vote. Just make sure you understand you have it in your control to determine what this country is going to look like the next 4 years. Is it going to change? You're going to get 4 more years of these lies.
Mr. President, 2 minutes.
So when I listened to Joe talking about a transition, there's been no transition from when I won. I won that election. And if you look at crooked Hillary Clinton, if you look at all of the different people, there was no transition, because they came after me trying to do a coup. They came after me spying on my campaign. They started from the day I won, and even before I won, from the day I came down the escalator with our First Lady. They were a disaster. They were a disgrace to our country. And we've caught them. We've caught them all. We've got it all on tape. We've caught them all. And by the way, you gave the idea for the Logan Act against General Flynn. You better take a look at that, because we caught you in a sense. And President Obama was sitting in the office. He knew about it, too. So don't tell me about a free transition. As far as the ballots are concerned, it's a disaster. A solicited ballot, okay, solicited is okay. You're soliciting, you're asking, they send it back, you send it back. I did that. If you have an unsolicited, they're sending millions of ballots all over the country. There's fraud. They found them in creeks. They found some with the name Trump, just happened to have the name Trump just the other day in a waste paper basket. They're being sent all over the place. They sent 2 in a Democrat area. They sent out 1,000 ballots. Everybody got 2 ballots. This is going to be a fraud like you've never seen. The other thing, it's nice on November 3rd, you're watching and you see who won the election. And I think we're going to do well, because people are really happy with the job we've done. But you know what? We won't know. We might not know for months, because these ballots are going to be all over. Take a look at what happened in Manhattan. Take a look at what happened in New Jersey. Take a look at what happened in Virginia and other places. They're not losing 2%, 1%, which, by the way, is too much. An election could be won or lost with that. They're losing 30 and 40%. It's a fraud, and it's a shame. And can you imagine where they say you have to have your ballot in by November 10th? November 10th. That means that's 7 days after the election, in theory, should have been announced.
Okay.
We have major states with that,
sir,
all run by
2
Democrats.
2 minutes is 2 minutes.
All run by Democrats. It's
President Trump,
it's a rigged election.
you're going to be able to continue. You have been charging for months that mail-in balloting is going to be a disaster. You say it's rigged, that it's going to lead to fraud. But in 2018, in the last midterm election, 31 million people voted mail-in voting. That was a quarter, more than a quarter of all the voters that year cast their ballots by mail. Now that millions of mail-in ballots have gone out, what are you going to do about it? And are you counting on the Supreme Court, including a Justice Barrett, to settle any dispute?
Yeah, I think I'm counting on them to look at the ballots, definitely. I hope we don't need them in terms of the election itself. But for the ballots, I think so, because what's happening is incredible. I read today, where at least 1% of the ballots for 2016 were invalidated. They take them. We don't like them. We don't like them.
But what are you going to do about it? There are millions of ballots going out right now.
What you do is you go and vote. You do a solicited ballot, and that's okay, or you go and vote.
I'm asking you about the fact that millions of people...
You go and vote. You go and vote.
But
like
what I'm
they,
saying is,
like
what are you
they
going
used
to do
to
about the
in the
fact that millions of people...
You either do, Chris, a solicited ballot where you're sending it in, they're sending it back, and you're sending... They have mailmen with lots of it. Did you see what's going on? Take a look at West Virginia, mailmen selling the ballots. They're being sold. They're being dumped in rivers. This is a horrible thing for our country. This is not going to end well.
There is no
this is not going to end well.
5 states have had
go ahead,
mail-in ballots for the last decade or more. 5, including 2 Republican states. And you don't have to solicit the ballot. It's sent to you. It's sent to your home. What we're saying is, they're saying is that it has to be a postmark by the time, by Election Day. If it doesn't get in till the 7th, 8th, 9th, it still should be counted. He's just afraid of counting the votes because he knows the outcome.
You're wrong.
I want to continue with you on this, Vice President Biden.
Chris, he's so wrong when he makes a statement like that.
Excuse me. Vice President Biden, the biggest problem, in fact, over the years with mail-in voting has not been fraud historically. It has been that sizable numbers, sometimes hundreds of thousands of ballots are thrown out because they have not been properly filled out, or there is some other irregularity, or they missed the deadline. So the question I have is, are you concerned that the Supreme Court with a Justice Barrett will settle any dispute?
I'm concerned that any court would settle this because here's the deal. When you get a ballot and you fill it out, you're supposed to have an affidavit. If you didn't know, you have someone say that this is me. You should be able to, if in fact you can verify that's you before the ballot is thrown out, that's sufficient to be able to count the ballot because someone made a mistake and not dotting the correct I. Who they voted for, testify, say who they voted for, say it's you. That is totally legitimate.
All right.
Excuse me, Chris, when you have 80 million ballots
I have a final
sent in
question.
and swamping the system, you know it can't be done. You know it can't. And already there's been fraud.
Mail service delivers
wait a minute, gentlemen. And the final question is, in 8 states, we can keep talking. In 8 states, election workers are prohibited currently by law, 8 states, from even beginning to process ballots, even take them out of the envelopes and flatten them until Election Day. That means that it's likely, because there's going to be a huge increase in mail-in balloting, that we are not going to know on election night who the winner is, that it could be days, it could be weeks,
could be months,
until we find out who the new president is. So first for you, sir, finally for the Vice President, I hope neither of you will interrupt the other. Will you urge your supporters to stay calm during this extended period, not to engage in any civil unrest? And will you pledge tonight that you will not declare victory until the election has been independently certified? President Trump, you go first.
I'm urging my supporters to go into the polls and watch very carefully, because that's what has to happen. I am urging them to do it. As you know, today there was a big problem. In Philadelphia, they went in to watch. They're called poll watchers, a very safe, very nice thing. They were thrown out. They weren't allowed to watch. You know why? Because bad things happen in Philadelphia. Bad
things happen in Philadelphia, Trump says at debate. Renewing false claim about poll watchers, Trump closed out the first debate by repeating his false claim that poll watchers had been blocked from observing the first day of in-person early voting in Philly. President Donald Trump closed out his first presidential debate with Democratic nominee Joe Biden on Tuesday night by repeating on national television his false claim that poll watchers had been blocked from observing the first day of in-person early voting in Philadelphia. Today there was a big problem, Trump said in the closing moments of the debate. In Philadelphia they went in to watch. They're called poll watchers. A very safe, very nice thing. They were thrown out. They weren't allowed to watch. You know why? Because bad things happen in Philadelphia. Bad things. But there were several reasons why election staff did not allow members of the public to arbitrarily enter their offices. The Trump campaign has no poll watchers approved to work in Philadelphia at the moment. There are no actual polling places open in the city right now. And elections officials are following coronavirus safety regulations, such as those limiting the number of people indoors. It's true that voters were casting ballots Tuesday, but the locations where they were doing so are satellite elections offices where mail ballots can be requested, completed, and submitted. Poll watchers don't have the same rights at such locations as they do at traditional polling places on Election Day, officials said. We don't give someone a poll watcher certificate to watch somebody fill out their ballot at their kitchen table, said Al Schmidt, a Republican and one of the city commissioners who run elections. Trump made the false claim earlier in the day on Twitter, first retweeting Son Eric and then going further to accuse city officials of corruption. Well, won't let poll watchers and security into Philadelphia voting places, he said. There is only one reason why: corruption. Must have a fair election. The claims come as Trump, who is consistently trailing Democratic nominee Joe Biden in national polls and surveys of critical battleground states like Pennsylvania, has sought to sow doubt about the legitimacy of the election with false attacks on mail voting is susceptible to widespread fraud. He has also suggested he may not accept the results if he loses. State law allows campaigns and parties to appoint multiple poll watchers per precinct, who are permitted inside polling places to observe and, in some situations, raise legal challenges. But no poll watchers have been certified yet for the Trump campaign, the Republican Party, or other Republican campaigns, said Nick Custodio, deputy city commissioner under Lisa Dealey, chair of the city commissioners. The commissioners opened the first satellite offices Tuesday for a new form of early voting using mail ballots. At the satellite locations in the main elections office and City Hall, voters can apply for a mail ballot and receive one on demand, as well as fill it out and turn it in. At least one woman claiming to be a Trump campaign poll watcher was barred from entering one of those satellite offices Tuesday in the Overbrook section of West Philadelphia. But Custodio said, these are not polling places. Instead, they are just like the main office in City Hall with no specific poll watcher rights. The only people who are there are those who are working or those who are availing themselves one of the office's services, he said. Workers are also being strict about social distancing, Custodio said. We have to be extra cautious about maintaining social distance and making sure that people are supposed to be there and limiting crowds. And just like in City Hall, Custodio said, members of the public can be asked to leave for any number of reasons. Thea McDonald, the spokesperson for the Trump campaign, said Tuesday that the campaign has demanded a response from the city commissioners and, if necessary, will pursue all available legal and equitable remedies. About 1 p.m. Tuesday, a woman approached the supervisor at the entrance of the satellite office at Overbrook Elementary School. She said she was there to monitor the integrity of the election and asked to be allowed inside. The supervisor told her she was not allowed inside the building unless she was using the office's services. The woman did not present any sort of certificate of being an official poll watcher, but calmly stated that she had a right to be inside. The woman told the Inquirer she was hired by the Trump campaign to oversee the integrity of the election. She said she was paid to monitor the West Philadelphia site. She would not provide her name or any further information, and she left the area shortly afterward. The Trump campaign, in a complaint filed in federal court in Pittsburgh in July, accused state and county election officials of the arbitrary and illegal preclusion of poll watchers from being present in all locations where votes are being cast because mail ballots are not being returned to official polling places before Election Day. The complaint seeks a ruling or injunction that permits poll watchers, regardless of their county of residence, to be present in all locations where votes are cast or counted, including without limitation all locations where absentee or mail-in ballots are being returned. That lawsuit is ongoing. The state Supreme Court ruled earlier this month against the Trump campaign's request to allow poll watchers to operate in counties other than the one where they are registered to vote. The Pennsylvania Department of State declined to comment Tuesday, citing the ongoing federal litigation. Mayor Jim Kenney on Tuesday urged Philadelphians to reject these false accusations. We will undertake a fair and accurate election according to the laws of this Commonwealth, not the president's tweets, he said in a statement. Trump's campaign has been aware since 2016 of the state law regulating poll watchers. While campaigning 4 years ago, Trump frequently made ominous and unsubstantiated claims during rallies in Pennsylvania about efforts to steal or rig the election in favor of Hillary Clinton. It is so important for you to go out and watch other communities, he said at one point in western Pennsylvania that year. Trump has been at it again this month, urging supporters at rallies in Nevada and North Carolina to sign up as poll watchers to prevent fraud. Be poll watchers when you go there, he said in Winston-Salem, NC. Watch all the thieving and stealing and robbing they do. The Pennsylvania election code has held since 1937 that only candidates and political parties can appoint poll watchers. Those watchers must have a certificate verifying their status and be registered to vote in the county where they are watching a polling place. The Pennsylvania Democratic Party filed a federal lawsuit 9 days before the 2016 election, accusing the Trump campaign of conspiring to threaten, intimidate, and thereby prevent minority voters in urban neighborhoods from voting in the 2016 election by sending in out-of-town poll watchers. U.S. District Judge Gerald Capert, a former Republican state attorney general, rejected a request then from the Trump campaign to allow poll watchers to come from anywhere in the state.
Things. And I am urging my people. I hope it's going to be a fair election. If it's a fair election, I am 100% on board. But if I see tens of thousands of ballots being manipulated, I can't go along with that. And I'll tell you what,
does that mean,
from a common sense,
does that mean you're going to tell your people to take to the street?
It means you have a fraudulent election. You're sending out 80 million ballots. They're not equipped to. These people aren't equipped to handle it. Number one. Number two, they cheat. They cheat. Hey, they found ballots in a waste paper basket 3 days ago, and they all had the name military ballots. They were military. They all had the name Trump on them.
Vice President
you think
Biden,
that's good?
Vice President Biden, final question for you. Will you urge your supporters to stay calm while the vote is counted, and will you pledge not to declare victory until the election is independently certified?
Yes, and here's the deal. We count the ballots, as you pointed out. Some of these ballots in some states can't even be opened until Election Day. And if there's thousands of ballots, it's going to take time to do it. And by the way, our military, they've been voting by ballots since the end of the Civil War, in effect. And that's what's going to happen. Why was it not? Why is it for them somehow not fraudulent? It's the same process. It's honest. No one has established at all that there is fraud related to mail-in ballots, that somehow it's a fraudulent process.
It's already been established. Take a look at Carolyn Maloney's race in Manhattan.
You had an opportunity to respond.
Look at Carolyn Maloney.
Go ahead.
They have no idea what happened.
Vice President Biden, go ahead.
He has no idea what he's talking about. Here's the deal. The fact is, I will accept it, and he will too. You know why? Because once the winner is declared, after all the ballots are counted, all the votes are counted, that'll be the end of it. That'll be the end of it. And if it's me, in fact, fine. If it's not me, I'll support the outcome. And I'll be a president not just for the Democrats. I'll be a president for Democrats and Republicans. And this guy,
I want to see an honest ballot count.
Gentlemen, you say that's the end of it? This is the end of this debate?
Honest ballot count.
We're going to leave it there. To be continued as in more debates as we go on. President Trump, Vice President Biden, it's been an interesting hour and a half. I want to thank you both for participating in the first of 3 debates that you have agreed to engage in. We want to thank Case Western Reserve University and the Cleveland Clinic for hosting this event. The next debate, sponsored by the Commission on Presidential Debates, will be 1 week from tomorrow, October 7th, at the University of Utah in Salt Lake City. The two vice presidential nominees, Vice President Mike Pence and Senator Kamala Harris, will debate at 9 p.m. Eastern that night. We hope you watch. Until then, thank you and good night. Thank you.